for anyone who would like to drink coffee this morning, and we'll be starting very soon enough. Thank you. My voice.
That's all.
Okay.
Yeah, you need to raise
More power.
Yeah, more power. Yeah. That's why I just wanted to
everything, the hearts we are touching, the million hearts we have touched till now, and the million hearts we want to touch in future. It's all because of you people. And today that voice has been reached here in Bangkok, and I'm super blessed and thankful to everyone who have been manifesting this moment with me. Thank you so much. I'm very thank you. Thank you so much.
Hello, good morning. May I please ask everyone to kindly uh, be seated, find your seats, because the World Summit on Sustainable Health and Well-being will be starting soon. Thank you and have a great morning. in honor of the arrival of Minister of Public Health of Thailand. You may now be seated. Good morning and welcome to the World Summit on Sustainable Health and Well-Being. May I please kindly ask the participants to please come in front. If there's any available seats, you may take your seat. Feel free to take your seat in the front. Thank you. Ladies and gentlemen, before we begin, allow me to take a moment to walk you through the exciting journey we will be experiencing together today. Today's summit brings together global leaders, policymakers, health experts, innovators, youth leaders, and partners committed to advancing sustainable health and well-being for all. We start this morning with our opening plenary, joined by distinguished dignitaries and speakers who will share their reflections and visual for global health and sustainable development. Following our opening ceremony, we will be witnessing two important memorandum of understanding signing ceremonies. First, with Siam University, and later with UNESCO Youth Education Research Center, CREGU. These partnerships symbolizes our collective commitment to collaboration, research, youth empowerment, and capacity building for a healthier tomorrow. We will then move on into our first high-level panel, focused on building resilient health systems from clean water to global health security. Here, we will explore how sustainability, public health, human rights, and preparedness all connect to shape a resilient future. After that, we will break for a networking lunch, a wonderful opportunity to meet fellow delegates, exchange ideas, and build meaningful connections. We will then hear inspiring youth speakers, our future leaders, followed by our closing remarks. And finally, we will conclude the days with interactive networking and high tea, giving all of us a chance to reflect, connect, collaborate, and continue these important conversations. Thank you, and we look forward to an impactful, inspiring, and collaborative day ahead. Excellencies, distinguished leaders, honored guests, ladies and gentlemen, good morning. สวัสดีค่ะ. On behalf of the Sustainable Development Council, we will welcome you to this global platform committed to advancing health, well-being, and sustainable development for all. Today, we gather to champion equity, resilience, and innovation in health systems worldwide. As we begin, we humbly invite all delegates to join us in a solemn tribute. We honor the life, legacy, and gracious service of Her Majesty Queen Sirikit, the Queen Mother of Thailand, whose profound contribution to healthcare, social development, and welfare of women and children continue to inspire generations. May I request everyone to kindly rise and observe a moment of silence in her honor. Thank you. Please be seated. Welcome our young and energetic leader from Thailand. I invite Ms. Samalin Tawa, Country Representative for Thailand, Sustainable Development Council.
Excellencies, distinguished guests and delegates, honorable guests, ladies and gentlemen, my name is Sam Lin Thua, and a very good morning to all of you and welcome to the World Summit on Sustainable Health and Wellbeing 2025. On behalf of the Sustainable Development Council, or SDC, it is my great honor and privilege to extend a warm welcome to all distinguished guests joining us today at the United Nations Conference Center in Bangkok. The Sustainable Development Council is a non-government organization with consultative status under the United Nations ECOSOC. Our mission is to promote the principles of the Sustainable Development Goals through collaboration among governments, academic, civil society, and the private sector, empowering youth and communities to take part in shaping a more inclusive and sustainable future. This summit embodies that vision, uniting leaders from various sectors to explore how sustainability can be integrated into health system, ensuring that the well-being of people and the planet are advanced together. We are deeply honored to have with us today several distinguished guests whose leadership and commitment have greatly contributed to public health, innovation, and sustainable development. I would like to extend our special welcome to Dr. Dachana Murati Ramu, Chairman of the Sustainable Development Council, Honorable Mr. Pattana Prompat, Minister of Public Health, Royal Thai Government, His Excellency Fayaz Murshid Kazi, Ambassador and Permanent Representative of the UNCC Embassy of the People's Republic of Bangladesh in Bangkok, YB Yuneswaran Ramaraj, Honorable Member of Parliament, Government of Malaysia, Professor Dr. Shairatna Tipwet, Acting Director of Singhanakon Hospital, Songkhla Province, Thailand, Mr. Rahul Kesi, Co-founder of the International Youth Forum, Dr. Shilpa Niga, Chief Dental Surgeon, Apollo Dental, India, Ms. Pimprapai Traithan, CEO Officer, Senior Manager, Bitcup Capital Group Holdings Company Limited, and Dr. Pornchai Mongkhonwanit, President of Siam University. It is truly great honor to have your presence and support at this important gathering. Once again, on behalf of the Sustainable Development Council, I wish everyone an inspiring and fruitful discussion ahead. Thank you very much. Now it's my great pleasure to invite Dr. Dachana Murati Ramu, Chairman of the Sustainable Development Council, to deliver the presidential address. Thank you.
Honorable Minister, Excellencies, distinguished delegates, esteemed colleagues, dear youth leaders, and the global change makers. It's my profound honor to welcome you to this historic gathering, the World Summit on Sustainable Health and Well-being. Today, we do not meet nations and the institution alone. We meet the humanity united by a shared purpose and a moral responsibility. Because the truth is very simple, powerful, and universal. Health is a human right, and ensuring that right is a shared duty. We stand at the defining moment. Our world has witnessed unprecedented disruptions, a pandemic that exposed deep inequalities, climate events that uprooted lives and strained the health system, a silent mental health crisis affecting youth in every continent, every country, and every streets of this world, widening socio-economic divides. We learned that disease knows no borders. We learned something even deeper: inequality is dangerous than any virus. Let's consider this simple reality. A child born in a poorer country is up to 13 times more likely to die before the age of 5 than the child born in the wealthier nations. Over 6.6 million people, or almost at 84% of humanity, lives in countries that insufficient public health investment. And even within the nations, wealth, gender disability, and the social context still determine who lives and who left behind. These are not statistics. These are human beings. Someone's child, someone's parents, and someone's dreams. There is no freedom without a right to health. There is no dignity where access to care depends on a privilege. We cannot accept the world where young girl's dreams ends at the clinic door because she lacks on reproductive care and nutrition. We cannot accept the world where rural childs receives delayed treatment, where urban centers advance in technologies. We cannot accept the world where the poor bury family from the disease long queued elsewhere. Health inequity is not fair and it's a failure. We must correct it. Our mission here is courageous and clear. Strengthen universal health coverage, so care not is a privilege. Advance climate justice because a burning planet cannot heal its people. Support mental health, especially for the young facing uncertainty and the pressure. Protect women's and girls' rights, a cornerstone of equality. Empower the frontline workers and the communities without whom system collapse. Harness the digital health and the innovation, but ensure the access reaches the last mile. And above all, but people at the center of every policy. Technology can transfer system, but compassion transform the lives. To the young people in this room and the millions of watching beyond it, you are not the beneficiaries of a progress. You are the architects of tomorrow, leaders of the solutions and the guardians of the planet. The summit is not only for you, and it's within you. Let's speak honestly. Around the world, young people are struggling, not just economically, but emotionally. Let it be said that there are leaders choose equity, more privilege, justice over the convenience, humanity, and over indifferences. When the future generations ask what legacy we left for them, let our answer be clear. We build the world where the health is not a luxury and it's a birthright. We stood firm when it is mattered. We listened when it's difficult, and we acted when others waited. Today, as we speak about health, dignity, and the human rights, we must acknowledge a painful reality in our world. Across the region, the family trapped in the conflict and the war, homes are destroyed, hospitals are damaged, doctors and nurses are risking their lives just to save others. In every battlefield, it's not only building that fall, childhood fall, dreams fall, and every fabric of humanity is shaken. Where there should be a slaughter of children, there is fire. When there should be schools and clinics, where are shelters and sharings. No child grow up hearing the explosion instead of hope. No mother should worry more about finding their medicines and finding the food. No health worker should ever be targeted for choosing to save the life. Peace is not a separate from the public health. Peace is a foundation of public health. A wounded wall cannot heal. A divided wall cannot protect its most vulnerable. Let us affirm together with the clarity, with the compassion, with the courage. We stand for the peace. We stand for the civilians. We stand for every human life. Because the world we build must be a world where the dignity lives louder than violence, where the health and the humanity rise above the conflict. My friends, let us move forward with the courage and the compassion and convictions. Let us shape a world where every voice matters, every life is valued, and every person can live with dignity, health, and hope. Let me end up with a quote. Health is not a privilege delivered by the system. It's a right promised by the humanity. It's our duty is not to only heal illness, but build a world where the dignity, equity, and the well-being are the foundation of the life of every person. And thank you, and I wish you all for a purposeful and inspiring transformative summit, and thank you.
Thank you, Dr. Ramu. Excellency, distinguished delegates, ladies and gentlemen, it is now my honor and privilege to invite to the podium our esteemed chief guest, a distinguished statesman and a respected steward of public health in Thailand. The Honorable Mr. Pattana Prompat, Minister of Public Health of the Royal Thai Government, has been a driving force in strengthening Thailand's healthcare system, advancing universal health coverage, and enhancing national preparedness and public health security. Under his leadership, Thailand continues to stand as a global model for people-centered health system, equitable access to care, and sustainable health development rooted in compassion, innovation, and community empowerment. His commitment to the well-being of all people, especially vulnerable populations, reflects the highest values of public service and global solidarity. Excellencies, ladies and gentlemen, please join me in welcoming the Honorable Mr. Pattana Prompat, Minister of Public Health of the Royal Thai Government, to deliver his address.
Swadikap. Excellencies, distinguished delegates, ladies and gentlemen, it is a profound honor to address this inaugural World Summit on Sustainable Health and Well-being. My sincere gratitude goes to the Sustainable Development Council, or SDC, for bringing us together to discuss the critical foundation for our shared future, the health of our people and our planet. As the Minister of Public Health for Thailand, I bring a deep commitment to the 2030 agenda. Our ministry leads this effort, and we know the collaboration is our only path to success. But today, I wish to move beyond celebration and speak with candor about the gaps that threaten our 2030 promises. While we are proud of our foundation in the Universal Health Coverage, UHC, this foundation exists to help us solve our most persistent challenges. And for some critical goals, the current path is simply insufficient. Esteemed colleague, I speak specifically of two targets where progress has tragically stalled, not just in Thailand, but globally. First, the goal is to end the epidemic of tuberculosis by 2030. Despite our best effort, TB remains a significant public health burden, and the 2030 target appears unachievable with our current tools and strategies. Second, the urgent need to halve death and injury from road traffic accident. RTI remains a leading cause of death and disability, particularly among our youth. And our progress does not match the scale of this preventable tragedy. To conquer these challenges, we must pivot from incremental change and exponential acceleration. We must fully embrace the World Health Organization recommendation for the SGD accelerator, which call for the paradigm shift. This shift rests on two pillars: strategic investment in research and development, and the at-scale implementation of digital health and artificial intelligence. Technology and data are the keys. In Thailand, we are laying an essential groundwork for this transformation. I am proud to announce that just this past Tuesday, October 28th, we achieved a landmark National Digital Health Governance Agreement. This agreement is not just a policy, it is a technical and legal foundation for a tangible action. For tuberculosis, this government framework will finally enable the data continuity need for comprehensive detection and treatment, especially in the complex urban area like Bangkok. Critically, it unlocks our ability to deploy national-scale, open-source AI system for interpreting radiographic screening, helping us find cases faster, earlier, and more accurately. For road traffic injuries, it allows us to connect disparate data from health, transport, and law enforcement. This connected data will empower AI-driven model for predicting high-risk area and times, enabling preventative intervention before the next accident happens. To realize these ambitious visions, we must view health technology not as at a cost, but as a strategic investment. We must aggressively embrace this digital transformation to strengthen our health security and surveillance. But this demands global solidarity. No single country can develop, validate, and deploy this advanced system alone. We need strengthened multilateral cooperation, a shared commitment to open source R&D, and a collective effort in building capacity for AI governance. The SDG's role in fostering this essential cross-sectoral dialogue, linking health and finances, transport, digital economy, is more critical than ever. Ladies and gentlemen, let us commit today not just to the goals we can easily reach, but to the challenging one that truly define our commitment to leaving no one behind. Thank you.
Our next distinguished speaker is YB Yuneswaran Ramaraj, Honorable Member of Parliament of Malaysia. YB Yuneswaran is widely recognized as a passionate advocate for youth empowerment, good governance, social equity, and inclusive development. Through his leadership and active engagement in parliament affairs, he continues to champion policies that foster education, innovation, community advancement, and cross-border collaboration across the ASEAN region and beyond. His strong commitment in strengthening democratic participation and supporting young leaders reflects his beliefs in future built on shared values, dignities, and opportunity for all. Your Honorable, we are grateful for your presence. Ladies and gentlemen, please join me in welcoming YB Yuneswaran Ramaraj to deliver his remarks.
Very good morning, ladies and gentlemen, distinguished guests, honorable minister, dear friends and colleagues around the world. We are in a well-being conference, so expecting some smiles and laughters. Because we need to be very wealthy and healthy and be very well-being human in this beautiful hall. Health cannot be questions of income. It is a fundamental human rights, said and quoted by our great leader Nelson Mandela. It is an honor to join this summit this morning and to meet all of you. And we are talking about the health and the future of a human development, mental health and well-being. Today, the world stands at a critical moment. We are navigating global uncertainties from economic shocks, the climate anxieties and digital disruptions, and the geopolitical tensions. Yet, despite all these external pressures, there are quite a universal challenge, the mental and emotional well-being of our people. Mental health is not a side note in a public policy. It is not a soft issue. It is a fundamental pillar of a national resilience, human capital development, and a sustainable economic progress. As leaders, policymakers, and advocates, we must recognize there is no sustainable development without a mental well-being. There is no resilient economy without a healthy mind. According to WHO, mental health disorder cost a global economic over $1 trillion USD annually, primarily due to the loss of productivity. The rapid increase of communicable disease and non-communicable disease in the global community is alarming. But beyond economics, it is a loss of human potential, creativity, dignity, and hope that weighs most heavily. We can see nowadays young people are literally struggling in such crises that needs help. We can see many young people in this hall. We must shift from treating mental health as a medical concern to embracing it is in a whole government of society priority embedded in education system, labor policies, urban planning, digital regulations, and community developments. I believe that in parliaments, in the House of Representatives, we always allocate more funds to manage health crisis. But it's a question of how much we're spending to prevent or the preventive care. It is very important nowadays. And we must invest early in children, in families, in workplaces, and communities, ensuring every person has access to support without stigma and without fear. We must break silos, strengthening interministerial action, expanding primary care capacity, and embracing innovations including digital mental health solutions and culturally grounded support. I'd like to congratulate the Thai government for a great initiative as recently launched. It shows that the commitment of the government of Thai that we are moving to face the bigger challenge. We are halfway to 2030 agenda, yet far from where the world must be. The pandemic exposed the fragility of many health systems around the world. Climate change threatens lives and livelihoods. Demographic shifts, aging populations, youth mental health challenges, and rising chronic disease demand new thinking. Technological disruptions offer opportunity but also risk deepening inequality if access is not equitable. Geopolitical crises, conflicts in Middle East, and recent conflicts in Africa, Sudan, Nigeria, Ukraine, Russia, and the Gen Z protests across the world, part of the world, is something that we really need to look into it. Geoeconomic issues faced by many countries, especially in the trade industries. I believe that most of the ASEAN countries have faced this recently. And we must understand and acknowledge that resilience is not building or built during the crisis, it must embedded long before. Mental health is universal in transcends borders, cultures, religions, and economics. Awareness is rising, but awareness alone, it is not enough. We must have actions, investment, and political will to push for harder. Let us leave this summit not only with strategies, but with the commitment to protect the most vulnerable, especially women and children, to empower our young people and provide better environment, to create dignified mental health workplaces, to strengthen community resilience with ASEAN and other regions of the world, and to build future where well-being is recognized as a human right. For when nations care for the minds and hearts of the people, they build society that are stronger, kinder, and more united. May this summit ignite meaningful partnership, enrich our collective understanding, and guide us towards policy models that upholds wellness, dignity, and human flourishing. Let us move forward with humanity, humility, determinations, and shared purpose to build systems that do not break in crisis, to design policies that leave no community behind, and to honor the SDG promise that every life matters and every person deserves opportunity to live in health, dignity, and hope. Thank you very much.
Thank you, Honorable Minister. Our next, may I please invite over Mr. Fayaz to comment on our next distinguished speaker is His Excellency Fayaz Murshid Kazi, Ambassador and Permanent Representative of the People's Republic of Bangladesh to the United Nations Economic and Social Commission for Asia and the Pacific, is widely recognized for his commitment to advancing regional development, peace, and international partnership. His Excellency has played a pivotal role in promoting inclusive diplomacy, sustainable development, and meaningful dialogue among nations, championing the vision of shared prosperity and global solidarity across Asia and beyond. Excellencies, ladies and gentlemen, please join me in warmly inviting His Excellency Fayaz Murshid Kazi to deliver his guest of honor address.
Good morning, Swadhi Khab. I'm sorry I'm perhaps a bit late. Apologies for that. But it's great to be here. And thanks to the Sustainable Development Council, WHO, and other organizers for inviting us here to discuss a topic which resonates with each one of us, sustainable health and well-being. It's great to see so many young faces across the room. And that's what I love about these kind of platforms, that we get to interact with the younger generation. I don't know why these things have been said about me. I don't think I have really done anything to contribute to global inclusive development and all that was claimed. But it's always a pleasure to talk to the new ambassadors who would be ushering in a world of inclusive development. I did have a prepared speech, but when I saw these young faces, I thought that I would not overburden you with a lot of heavy points. Maybe just a few things that I want to leave behind with all of you. First, UHC, the Universal Health Coverage. That is the biggest and most important motto of the Sustainable Development Agenda. Our world had committed that by 2030, we would be achieving universal health coverage across the world. Many of you come from different parts of the world, and you know that that still remains a far-fetched aspiration. Our world, we have not been able to move substantively in the direction of universal health coverage. We are still not in a situation where we can ensure health and well-being for each one of our citizens. But that should not be a cause for disappointment or despondency. We cannot give up. We know that our world has many challenges, but if young people like you become the true advocates of universal health coverage, there is no reason that at some point we shall not achieve this goal. Second, climate change impacts on health. This is something all of you are experiencing almost on a daily basis. Be it heat wave or air pollution, we can see the climate impacts on our health systems every single moment. And we have to do something about it. The good news is the world is talking about it, but you, the future citizens of the world, you must speak out, because whatever we do now, in our generation, in our time, would actually determine the kind of life, kind of health, kind of well-being that you would be having. So climate and health, that should be an issue that must remain the foremost on our mind. Third, neglected tropical diseases. Since we are here in Southeast Asia, let's remember that we still have diseases like cholera, dengue, chikungunya, and many others for which we have not yet been able to find effective treatments. And we often call them neglected tropical diseases. Why are they neglected? Because we are not really investing in research and innovation for their treatment and prevention. But many people in our countries, in our parts of the world, in the global south, they still suffer from many of these diseases. With simple investments, with simple innovations, with simple treatments, many of these could actually be curable. Do you know the good news? That our world is finally perhaps at a stage when we can eliminate malaria from this world. We are almost there in the last mile. We had done similar things with debilitating diseases like polio. Our world had won these battles. So there is no reason why we should not be able to combat and defeat other diseases that are threatening us. And it's not just us. I read a few years ago that even in Greece, they are now experiencing chikungunya or dengue. Because of climate change, because of heat wave, because of global warming, many of the diseases that we experienced in our part of the world are now also moving to other parts of the world, to the global north. So we all have a collective interest in combating these issues. Fourth, antibiotics. This is a major health scare. Up to our generations, we were not always very aware of this threat. We were not very responsible about this threat. But now we know much more better than we used to before. So as youth advocates, please make sure that there is not indiscriminate use or prescription of antibiotics. Antibiotics has been absolutely critical, make no mistake. Antibiotic has been absolutely critical for saving millions of lives. Antibiotics was probably one of the greatest inventions of human civilization. But overuse of antibiotics can be deadly. There are many patients around the world who are now suffering from this phenomenon called antimicrobial resistance. It's a difficult technical term, but commonly you would see the words or acronym AMR. Please keep that in mind, and from your respective points, raise your voice about this so that we do not face this challenge with our future generation. One last word on that. To combat AMR, antimicrobial resistance or microbial resistance, The world is now promoting a One Health approach. So it cannot just be about human health. It is also important what we are feeding, what kind of antibiotics we are feeding to our animals or fish. It's also important what kind of fertilizers and pesticides we are using to grow our crops. So it's a One Health approach that we have to take to prevent antimicrobial resistance. And maybe my last point. A lot is being said about non-communicable diseases. And in addition to that, as the Honorable Member of Parliament from Malaysia just did, mental health issues. These are definitely alarming challenges, particularly among our young people. I'm sure you know that more people now in the world are dying of non-communicable diseases than of communicable diseases. As I said, malaria, polio, measles, these things are almost becoming matters of the past. They are still huge challenges, but they are not killing people, as many people as heart diseases, diabetes, or cancer. These kind of non-communicable diseases are killing people. So what do we have to do? As again other speakers have said, we have to make sure that the treatments for non-communicable diseases are available for everyone at an affordable cost. One thing that this platform is talking about, that many people still slide into poverty because they have to spend a lot of money for treatment for these kind of diseases. So treatment for heart diseases, cancer, or diabetes, these need to be made affordable and accessible to everyone. And the final thing, there are some new health hazards that are emerging that young people like you must talk about. You know, there are more children dying of drowning or road accidents now than of communicable diseases. These are serious problems. How many of you know how to swim? Can you raise your hands? Let us see. Wonderful. Almost 60%, I would say. So for the rest, 40%, please, these are essential skills that we must acquire. Drowning is still a big killer in this world. Maybe not for people of your age, but you know, little infants, little toddlers, they often kind of go into the water bodies, into ponds, into canals, and unfortunately they die because their parents are probably working, so they cannot always keep an eye on these children. But we need to save them. Every human life is precious. We cannot allow road accidents or drowning or these kind of public health hazards to kill our young people. So again, I know that you are here to become ambassadors, to become advocates for global health and well-being. So please raise your voice against these new public health hazards. I think I've spoken enough. We are looking forward to a more resilient and healthy world. We know we are in your good hands. The innovations that many of you are coming with AI and other emerging technologies, only augurs very, very well for the future health and well-being of our world. So let's keep working in that direction, and please help those who are lagging behind. People in countries like Bangladesh who do not have sufficient health care, who do not have affordable health care, please remember them, and let's join our hands to support those people. Thank you very much. Kapun Makha.
Thank you, Excellency. Our next distinguished speaker is Professor Dr. Chairat Natipwet, Acting Director of Singhanakon.
Great, Excellency, colleague, and friends. สวัสดีครับ Good morning. It is truly an honor to be here today at the World Summit on Sustainable Health and Well-being. Standing here at the United Nations among leaders, experts, and half passionate advocates from around the world reminds me of why I became a doctor in the first place, to help people live longer, healthier, and happier lives. Every day, in clinics and communities across of Thailand, we meet patients who are battling diseases that do not spread through the air or through connect, but through habits. They are the non-communicable diseases we are here to talk about today: diabetes, hypertension, heart disease, stroke, and many others. They are called non-communicable, yet they quietly spread through our families and societies, through what we eat, how we move, and how we live. They have become impossible epidemic of our generation. Today, more than 70% of deaths worldwide are caused by these diseases. And what is even more touching is that most of them are preventable. As a family physician, I have learned that the fight against NCD does not begin in the hospital. It begins at home, in the kitchen, in the dinner table, during a morning walk, and conversation between parents and children. Prevention is not only a medical intervention, it is a social movement. When we talk about sustainable health, we often think about technology, innovation, and healthcare system. But sustainability in health is also means giving people the knowledge and opportunity to take care of themselves before illness strikes. It means shifting from treatment to prevention, from hospital care to community care, and from fear to empowerment. Imagine if every community had access to healthy food, safe spaces for exercise, and regular health checkups. Imagine if every older adult in the village could walk confidently, free from pain, able to enjoy time with their grandchildren. This is not a dream. It is something we can build step by step through cooperation and compassion. In Thailand, we have seen inspiring examples. Local health volunteers visit elderly homes and monitor blood pressure and give simple health advice. Temples open their courtyards for morning exercise. Small lifestyle changes, like reducing sugar and salt, have saved lives. This community-driven model shows us that healthcare does not belong only to hospitals or doctors. It belongs to everyone. That is the essence of SDG 3, good health and well-being. Health for all by all. A sustainable health system is one where prevention is not an afterthought, but a culture, supported by policy, strengthened by education, and practiced by individuals every single day. Ladies and gentlemen, The future of healthcare will not be defined only by medical and machines, but by mindset. If we can change the way people think about their health, we can change the way the world lives. So, let us work together, governments, healthcare professionals, educators, and communities, to build a future where prevention is power, where health being is shared, and where no one is left behind. Let us make sustainable health not just a goal, but a way of life. Thank you very much.
Thank you, Professor Dr. Shairatnathiwet. We now have the pleasure of welcoming Mr. Rahul K.C., co-founder of the International Youth Forum. Mr. Rahul is a dynamic youth leader who has played a pivotal role in advancing global youth engagement, peace building, and the Sustainable Development Goals. Through his leadership and vision, the International Youth Forum has strengthened international cooperation, empowered youth, young changemaker across continents, and promoted inclusive platforms for dialogue, diplomacy, and development. He continues to inspire and support young people to become catalysts for positive social impact and global progress. Ladies and gentlemen, please join me in inviting Mr. Rahul K.C. to deliver his remarks.
So much. Good morning, distinguished guests, excellencies, dear friends. It is an honor to be here with you at the World Summit of Sustainable Health and Well-being. I come to you today not just a civic leader, but as someone who believes deeply in justice, in dignity, and in the simple truth that health is human rights. Dear friends, let me start with primary healthcare. Did you know that 80 to 90% of health problems can be treated at the primary care level? That means in local clinic, by community health workers, with basic medicines and early care. But today, half the world population still doesn't have access to those services. It is not just a gap in healthcare, it is a gap in justice. If we believe in rights, we must invest in primary health. Because dignity should begin at the doorstep, not just in distant hospital. We moved from MDG to SDG with bigger vision. In the year 2000, the world come together around the Millennium Development Goals, the MDGs. We made progress. We reduced child deaths. We fought HIV and malaria. But MDG were narrow. They focus on outcomes, not systems. In 2015, we moved to Sustainable Development Goals, the SDGs. And now SDG 3, the good health and well-being, call for a broader, fairer, and more inclusive approach. It connects health to climate, to equality, to peace, and to universal coverage. Let's talk about climate. In 2024 alone, wildfire smoke caused over 150 deaths. Heat-related deaths has gone up to by 63% since 1990s. Climate change is changing how disease is spread. It's making food and water less safe. It's forcing families to leave their homes. So yes, climate is a health issue. And health system must be ready. Clean air, safe water, and protection from climate shocks, these are the part of the right to health. In 2025, while talking about the health financing, in 2025, global aid for health dropped by $39 billion, the lowest in 15 years. This is not just a number, it's a warning. We must fund health based on need, not power. We must make sure money reaches the people who need it most. And we must align our budget with SDGs, especially SDG 3, SDG 10, which focus on health and reducing inequalities. In some countries, people in poor neighborhood live 20 years less than those in wealthy ones. This is not biology. That's injustice. Health equity means everyone, no matter where they live, what language they speak, or how much they earn, get respectful and quality care. It means listening to communities. It means removing barriers. It means putting dignity first. Right now, 1 in 4 people live in places affected by war, disaster, or fragility. This area sees 60% of preventable maternal deaths, and over half of the children dead under age 5. Even in crisis, health is a lifeline, and right must still apply. We must protect health workers, we must deliver care with compassion, and we must never forget, even in chaos, dignity matters. We need global collaboration for universal health coverage. It is a promise we must keep. Universal health coverage, or USC, is part of SDG 3, but in 2025, we are still off track. Too many people pay out of their pocket. This is affecting poverty alleviation. Too many to go without care. UHC is not just a coverage. It's about that is affordable, accessible, and anchored in rights. In the closing, as my friend Dr. Murthy also emphasized, health is not a favor. It's not a product. It's not something to be earned. It is a right. It is human rights. Let this summit to be a turning point. Thank you so much. Have a good day. Namaste.
Rahul KC. Our next honored speaker is Dr. Shilpa Nagar, Chief Dental Surgeon at Apollo Dental, India, and respected advocate for advancing oral health and women's health awareness. Ladies and gentlemen, please welcome Dr. Shilpa Nagar to share her message. Please welcome her. Finally, we're pleased to invite Ms. Pimprapai Traithan, CEO Office Senior Manager at BitCup Capital Group Holdings Cooperation Limited. one of Thailand's leading technology and innovation enterprises. Ms. Premrapai is a forward-thinking leader driving strategic development, digital innovation, and cooperative partnerships in Thailand's rapidly evolving tech ecosystem. Ladies and gentlemen, please join me in welcoming Ms. Premrapai Traithan to deliver her remarks.
Sawadee good morning, distinguished guests, ladies and gentlemen. It's such an honor to be here at the UNCC in Bangkok, the heart of the Southeast Asia's transformation. Today, I will spend roughly around 5 to 7 minutes sharing a couple points of what are we doing here. We are here for healthier future, right? And then we share some couple topics related to that. Today, I would like to share a simple but urgent message. Well, I'm actually carrying our founder's message to you as well. He realized that the biggest threat isn't disease, it's habits. We got used to being sick before caring. We got used to seeing aging as normal. And what if we can change it? Let's just zoom in to Thailand. Thailand is living longer but not living well. Our birth rate is at 70-year low. 1 in 5 Thais is now elderly. A third of our working age adults live with a chronic illness. And the healthcare costs have risen over 300% in just 10 years. We are facing longevity crisis, ladies and gentlemen. And we're facing this crisis is not just because we are aging, but our health span is becoming smaller. So we must change how we see health. So we must change our mindset against the longevity. Longevity is not a cost to be managed, but it's something that we need to invest in. It is the highest yielding asset that you can invest in, that any of us will ever own. And how do we do that? How do we share this mindset and attitude toward everyone? So we think about the power of the Zero Baht Foundation, of having Zero Baht longevity. I'm presenting you the simple 6 habits where you can practice every day. Why we believe in that? Because as the representative of BitCup Capital Group Holdings, at BitCup, we've proven that value can be democratized. And health is the most accessible opportunity of all. True longevity doesn't start with expensive treatments or biological shortcuts. It starts with the discipline and knowledge. The above that you can see is the 6 simple, zero cost habit that everyone can practice every day. Number 1, sleep. Try to prioritize it early and healthy to let your body repair itself. We call it a repairing cycle. The number 2 is nutrition. Eat the real food. By here I mean reduce the ultra-processed food, sugary or refined products. Number 3, movement. Build your muscle. It's a new aging currency, so invest in it. and try to move every 45 minutes. Number 4, purpose and community. Purpose and community does involve in the longevity. Be with someone who has a purpose to live longer. Be with someone, be with the community who want to lift you. Hydration. Drink enough water and keep your body in gentle motion. Number 6, environment. Try to filter the noise. Living in a good air quality, avoid air and chemical toxin that will damage your biology. These are the power law of longevity, the very easy 6 habits that you can start today, right here and right now. And how do we pass on these 6 habits to not just everybody in this room, but to more people, let's say to millions of people? We did the same way that BitCup do. We scale it using through infrastructure and technology. This super app called Stego, we just developing it and launched this year. This is a digital ecosystem that connects health data, AI, and blockchain to create personalized, secure, and transparent health journey, where you can have it in just in one single device, and everything about your health is showing on this screen. We use AI integration. Stego app reads the real-time health data from your wearables and turn it into actionable insights. And not just using AI and infrastructure and blockchain of trust as well. This information that record in the application, is this also verifiable and transparent? So empowering individuals, researchers, and the community alike. This is how Thailand can digitize the preventive health using technology to strengthen our biological foundation. We make it even more powerful, returning prevention into value as well. To make prevention sustainable, we must make it rewarding. That's the idea behind the health to earn theory. When people follow their personalized health plans, they will earn Stego points. It is the points that redeemable to the product or service, or even you can experience the well-being at the partners. It isn't just a loyalty system, it's the economic model that ties healthy behavior to tangible by linking the prevention to incentive so that we can reduce the long-term healthcare costs while also building a culture of proactive health. So my message today to young leaders, medical students, and invocators is this: be a health futurist. Think long-term, build system that make wellness scalable, inclusive, and data-driven. Because the most valuable asset is your body, your mind, your life. Let's invest in it together. Thank you. ขอบคุณค่ะ
Okay, yeah, thank you. That is my vice president. I'm delighted to work with you. Yeah, thank you.
Ladies and gentlemen, we now move on to a significant historic moment in today's summit. This memorandum of understanding represents a shared commitment to academic collaboration, research excellence, youth empowerment, and sustainable development initiative. Today, the Sustainable Development Council and Siam University, Thailand, joins hands to This collaboration reflects our collective belief that education is a catalyst for peace, progress, and sustainable future, and that strong institutions work together can inspire transformational change across borders. Ladies and gentlemen, please join me in congratulating both institutions as we witness the most important milestone.
Ms. Samalin Thawa, Country Representative of Thailand, Sustainable Development Council. Dr. Dacha Namusi Ramu, Chairman of Sustainable Development Council. Honorable Mr. Patana Promphat and other representatives from Minister of Health, Royal Thai Government. His Excellency Fayyad Murshid Kasai, Ambassador and Permanent Representative to UNSCAP, Embassy of the People's Republic of Bangladesh, Bangkok, and also a good friend of Siam University. YB Yones Waran Ramarat, Honorable Member of the Parliament of the Government of Malaysia, and also the representative and good team from World Health Organization, dignitaries, ladies, gentlemen, and our beloved students. As everybody has mentioned, health really is the foundation of peace, prosperity, and sustainable future. Today is a remarkable day why I myself, on behalf of Siam University, is attending the Summit on Sustainable Health and Well-being, which we already signed the MOU with the Sustainable Development Council. I wish that this MOU will be beneficial to our country and also our people. Dr. Dachemoti Ramu, under the primary object of this MOU, as has been mentioned, that to promote sustainable development through joint initiative in research, education, policy, advocacy, and more important thing is the youth activities. We also plan to have the youth activities, the leadership for youth within Thailand, and also extend to other countries as well. Right now, we also have done this kind of activities with one of our friends in Japan, that is Tokai University. But I think that this is not enough. We also like to work closely with this organization and expand the health activities, youth relationship. Siam University is comprised of 15 colleges, and one of our pillars is sustainability, where our 15,000 students study about sustainability as general education and as the aspect of other professional courses. We educate and act as innovative, a living laboratory for the community engagement. We also focus our activities now in Pasir Jalon district. And our students are not only learning about sustainability, but they are practicing in the Pasir Jalon communities every day, where we have the project called Time Bank in order to make the preparation for the aging society that Thailand is very fast entering into. And also, we also have another project called Healthy Space, where we turn the dangerous area and drug addicted area under the flyover into the healthy space, not only for the physical space, but for the space where the people working together, protecting the area together, and make them health literate. I believe that health is a human right, not a privilege, and university should be one of the important driving force for healthy, peaceful, progressful, and prosperous world. I also just have heard from Bill Gates 2 days ago that he states on the importance of the investment in health of the human being. He says that this is even more important than investing on the other aspect of environmental issue, because everything should be people-focused. So once again, together we hope to create a world where sustainability is not only a goal anymore, but will be the living reality for every generation. So let's work together. We are more than happy to work with this council. Thank you very much.
Thank you, Dr. Pornchai Wongkonwanit. We now begin with high-level panel 1, Building Resilient Health System from Clean Water to Global Health Security. This high-level panel explores how countries can build strong, equitable, and future-ready health systems, starting with the fundamentals like safe water, sanitation, and primary care, and extending to global preparedness, rapid response capabilities, and health security. Speakers will discuss practical strategies, policy innovations, and collaborative approaches to ensure that communities remain healthy, resilient, and protected from both everyday challenges and emerging global threats. Moderated by Dr. Melissa Asayu Sal, Suan Sunantha Rajapat University. Please welcome the distinguished moderator of the panel, Dr. Melissa Asayu Sal, to take the stage and introduce the panelists.
Dear Excellencies, dear distinguished guests, fellows, colleagues, leaders, future leaders, and everyone. First of all, I would like to say welcome again, and thank you so much for making your time and being with us today here. Thank you. So today we are going to be together almost 1 hour. I will be your moderator, Dr. Melissa Ayşegül. I'm a faculty member from Suan University. And we are going to have with 6 panelists today. Our first panelist will be Dr. Hui Quinn, Medical Officer from World Health Organization. Welcome again. And our second speaker will be Dr. Nisha Karanakuran, Medical Officer from Government of Malaysia. Welcome to Thailand again. And our third speaker is Professor Titat Chaviscinda, right? I did practice before I came here. That's great, okay. Deputy Director, NIDA Research Bureau, National Institute of Development Administration. Welcome here again. Thank you for being with us. And our 4 panelists will be Professor Prisana Kumchai, Director of the Human Rights and Sustainable Learning Center, Faculty of Law, Konkan University. And our first panelist will be Miss Angeli Nelson, Executive Secretary Manager, Bitcup Capital Group Holdings. And our last panelist will be today, Joanna Ting, Vice President, UNESCO Youth Education Research Center. Yes, I think we are done. Great. So I think it will be my duty right now to call everyone to the stage, please. Okay, I know everybody's hungry. We're going to be fast as much as possible. We need coffee, food, I know. But that will be a great session. You won't understand anything. The time will be so fast and smooth with all together. So, our distinguished guests, before we start today, it's a truly pleasure for me to welcome you again to today's session. And I would like to remind you, we are here to talk about building resilient health systems today, from clean water to global health security will be the title of our session. And today, we are here to talk about something very simple, but pretty powerful actually. How we can build stronger and more resilient health systems that can protect everyone and anywhere. And of course, we'll start from the very beginning. It is clean water and sanitation. You're going to hear a lot clean water and sanitation terms in this session a lot today, because this will be our main points, right? This session is closely connected to the WSSA-HW objectives and to the Sustainable Development Goals, of course. The first one, especially SDG 3, as you know that it means good health and well-being, and SDG 6 is clean water and sanitation. These 2 goals are too deeply actually linked to each other, because good health, it depends on clean water, and clean water systems depend on strong and healthy communities. So, ladies and gentlemen, dear distinguished guests, the past few years have shown us how fragile our global systems can be. But they have also shown us the power of collaboration, of course, between governments, scientists, researchers, and academia like us, communities, and international partners to prepare, to respond, and to recover all together. And around the world, we see many inspiring examples. From local water safety programs to digital tools that track disease outbreaks in real time. And these innovations show us that resilience is not about just resources. It's also about connection, creativity, and shared responsibility. And today we will hear this: detailed explanations from incredible group of experts. They're sitting next to me. I'm very lucky today. Who will share their perspectives on how to make health systems stronger, more inclusive, and more prepared for the future. Just to confirm before we move on, I'd like to kind of remind to all of our speakers, we're already actually run out of time, as you know that, so you're going to have only 5 minutes to give your speeches. After we finish 30 minutes, we're going to have Q&A session, we're going to get to questions, and you will have only 2 minutes to answer the questions. Thank you so much. And then we're going to make our closing remarks. We summarize actually everything and key takeaways from the discussion. Okay. I'm done. I'm not talking anymore. And our first panelist will be Dr. Ho In Quinn, Medical Officer from World Health Organization. And Dr. In Quinn will share the key points she considers most important within her expertise. The stage is yours, dear doctor. You're very welcome.
Hello. Hello. Yeah. Thank you very much, Dr. Melissa. I love your enthusiasm. So before I begin, I would like to express my heartfelt condolences on the recent passing of Her Majesty Queen Mother Sirikit of Thailand. Her lifelong dedication to public service and well-being of the Thai people remains an inspiration to us all. May she rest in peace. Thank you for the opportunity to speak today. It's an honor to join this vital discussion on the future of global health and how sustainable health systems intersect with the UN 2030 agenda. So how can access to clean water and sanitation act as the foundation of resilient health systems? So access to clean water and sanitation is not just a basic human right, it's the cornerstone of public health. At WHO, we recognize that without safe water, adequate sanitation, and hygiene, which is WASH, disease prevention becomes nearly impossible. From my previous work as head of vector control in Kuala Lumpur, I witnessed firsthand how water storage and sanitation directly influence the spread of dengue. Poor waste management and stagnant water lead to mosquito breeding, impacting thousands. Even basic improvements in drainage and waste collection significantly reduce transmission. Now, in my current role at WHO Global Service Center in Malaysia, we take an institutional approach ensuring water access and sanitation in workplace settings. For example, during the pandemic, we implemented enhanced hygiene protocols, including hand washing stations and environmental sanitations to reduce transmission risks in office environments. Clean water also supports broader health system resilience by preventing waterborne diseases like cholera and typhoid, reducing the burden on health services and enabling infection control in clinics and hospitals. WASH is a silent contributor to SDG 3 and SDG 6. Without it, health systems are reactive rather than preventive, and resilience depends on being preventive. A resilient health system anticipates and reduces risk. Clean water is foundation to that. Thank you.
Amazing. Thank you so much. Thank you so much again there, Doctor. That was a great pleasure to listen to you here.
Thank you.
So, Dr. Nisha Karanakuran, Medical Officer from Government of Malaysia.
Yes.
So, the microphone is yours, dear Doctor. Please.
Thank you so much, Dr. Melissa. I love your enthusiasm. You actually lifted up the whole hall, actually. Thank you. Excellencies, distinguished delegates, colleagues, and fellow advocates, good morning. I'm deeply honored to stand before you today, not only as a medical officer as Malaysia, but also a family medicine trainee, a community advocate, and a proud representative of nation committed to health equity and resilience. Our theme today, Building Resilient Health System from Clean Water to Global Health Security, is more than a policy ambition. It is a moral imperative, a direct call to across nation, the Sustainable Development Goals. Approximately 15 years ago, during my community medicine posting, I met a mother who walked 1 kilometer every day just to fetch water for her children each morning. This single act, as ordinary as it seems, determines whether her family stays healthy or ill. That, ladies and gentlemen, is where global health security begins. It begins with her, with every step she takes, with every drop she carries. It begins with her commitment to ensure she never has to walk that far again. Resilience begins with basics: a child drinking water, a clean drinking water, a mother accessing safe sanitation, a clinic with reliable electricity, protective equipment. These are not luxuries, these are foundation to health security. This is precisely why Sustainable Development Goal, clean water and sanitation for all. In Malaysia, we are proud to report that clean access water has reached over 97% of the population, with targeted efforts underway to close the remaining gaps in rural and underserved areas. Globally, the challenge remains immense. According to WHO and UNICEF Joint Monitoring Program, 2.2 billion people still lack safely managed drinking water, and 3.5 billion lack of safely managed sanitation. Every day, over 700 children under 5 still die from diarrheal disease linked to unsafe water, sanitation, and hygiene. These are just not numbers, but these are the reminders that our global health systems are as strong as our clean water foundations. Clean water is a preventive medicine. It protects us against waterborne outbreaks like cholera, typhoid, and hepatitis A. Outbreaks, antimicrobial resistance often arise where basic wash access is lacking. By strengthening water sanitation system, we strengthen our collaborative ability to prevent, detect, respond to public health threats. During the COVID-19 pandemic, taught us that no border can contain a virus and no nation can stand alone. We need solidarity, transparency, equitable access to countermeasures. We need systems that can anticipate, absorb, and adapt. Today, I call on all of us just to rebuild, but to reimagine. Let us design health systems that are climate resilient, community-driven, and future-ready. Let us align our efforts with SDGs, not as distant targets, but as daily commitment. Let this forum be a turning point. Let our conversation lead to action. Let our partnership be bold and enduring. Because every drop of clean water, every resilient clinic, and every empowered community brings us closer to a world where health is not a privilege, but a promise. Strengthening health system begins with equity, prevention, and collaboration. Thank you. Terima kasih.
Dear Doctor, thank you so much for explaining us the access to Clean Water and Sanitation Act as the foundation of resilient health systems. This is one of the crucial points of our actually session today. Thank you so much again. That was great. Thank you.
Thank you.
And dear Dr. Professor Dr. Titat Chavastinda, Deputy Director, NIDA Research Bureau, National Institute of Development Administration, please take us through your experience with us.
Okay, thank you. Good morning, everyone. Today, because the topic that I got is about how to build health resilience through the universities. But after you talk about the clean waters, that is not my areas. But I try to link what I'm talking. The project that I'm doing is at the Legal Policy Researcher at the National Institute of Development Administration that you mentioned. And my expertise is in the law school. So that is about how to do the research using the university to create a network, particularly in the law school, to create a new law in order to create the health system and health resistant system, particularly about the NCDs. As mentions, some ambassador mentions in this morning, talking about many people die, 20%. 70% of nowadays people die with the NCD that we call the non-communicable disease, like drink too much, smoking, no exercise, something like that. So that is come to the legal issues, whether how we can create a law in order to reduce the NCDs, reduce the death rates of the people in Thailand. So we believe that the command and control that use the punitive measures, for example, to command you, to order you to stop drinking, that is not workable animals. So that is, we try to think about the new ways, how to design the regulatory framework in order to change the behaviors by using the law as a tool to prevent the disease. So that is come to the new eras, and we use the law, policies, and the nudging theory about the behavioral economics in order to decide and change your behaviors, not by command and to punish you anymore, but to give you more incentive to change your behavior for the lifelong and for in the sustainable times. So this is come to the network of the university. This is the first time that the Thailand create the networks of the lawyers, particularly the law professors and other legal departments for the whole country. We create the pioneer groups in order to study about the preventive measures, or sometimes we call the positive legal measures, in order to reduce the NCDs. We have from the north, from the south, from the east, so they have like 10 scholars that we create a pioneer and then use them in order to elaborate more and then do the project. So this is a 2-year project, get the fundings by the Thai Health Foundations, what they call the foundation, promotion foundations also in Thailand. So that is a 2-year project in order to change the behavior for the next 20 years. So we think about this one, how to design by the comparative way. If you look in other countries in order to create the legal measures, positive one, not to punish you anymore, but change your behaviors, particularly in the youth and then all the people. So this is kind of in order to reflect about the build health resilience through university network and then particularly in the law, lawyers and the legal networks. So this is more challenge for us. And then I think that's for the briefly for 3 or 5 minutes, right? Thank you very much. But this is my idea.
Thank you. Actually, dear Professor, you said that this is not your expertise. I'm also a doctor in communication sciences. But from the point of my view, especially in that kind of important matters, being interdisciplinary and multidisciplinary studies, works, they will be more powerful. They will create more powerful solutions, and it will solve all the problems in a more creative ways and more strongly. Thank you. Your remarks were very important for this session. Thank you so much. Dear Professor Prisana Kumtai, Director of the Human Rights and Sustainable Learning Center, Faculty of Law from Konkan University, the stage is yours, dear Professor.
Excellencies, distinguished and colleagues. Good morning, everyone, and thank you, Dr. Melissa.
My pleasure.
Yeah. I would like to express my sincere appreciation for the opportunity to speak today on behalf of Human Rights and Sustainable Learning Center, Faculty of Law, Konkan University, to join this panel on building resilient health system from clean water to global health security, and to share a perspective from Northeastern Thailand. Our discussion today is built around a very important question. How can we advance the health dimension of Sustainable Development Goals in a way that makes health system more resilient, more inclusive, and truly accessible to everyone, including the most vulnerable? From our experience, the answer actually starts before people reach the formal health system. It starts with the environment people live in, the water they drink, the food they eat, and the way we design our city and communities. In the northeast of Thailand or in Isan, we see very clearly that consumption culture, urban growth without adequate public service, and changing lifestyle have become decisive social determinants of health. Rising NDCs, unsafe water in some rural areas, and environmental risks are not just medical problems. There are also problems of rights, of fairness, and of local governance. That is why, for us, access to clean and safe water is not just only about SDG 6. It is the entry point to SDG 3 on health, to health equity, and to building long-term resilience. And whenever communities still cannot access water and basic service equally. It is always the vulnerable group who are left behind first. Ladies and gentlemen, for these reasons, we believe that law and public policy must be used as tools to decide for the better health. We need to shift from the idea of treating people when they are sick to designing healthy and fair environments, including using legal measures to make healthy choice easy and affordable, empowering local governments to protect public space and community water source, creating incentive mechanisms so that the private sector also consider community health. This is exactly the direction we are talking through our project. Our project is developing legal measures and binding working of health, promoting lawyers to advance law and health policy, which we are implementing together with the Thai Health Promotion Foundation and NIDA, the research center led by Professor Thitat. Our vision is very clear: to improve people's health and well-being at every stage to life through prevention, and to make this measure adaptable for use at the local level. To make this vision a reality, we have placed the entry efforts within the development strategy of Khon Kaen province. It's moving toward become smart city, a medical hub, and a UNESCO learning city. Khon Kaen University therefore plays a catalytic role, not only as an education institution, but also as
Last 40 seconds there, Professor.
Okay. But also has a hub for social innovation in health that connect law, public health, local government, and civil society, improve people quality life. And the HRS Learning Center serves as a learning, academic, and creative space. This unit helps translate national health growth into local legal and policy instruments. We cannot achieve global health security if local communities are still facing water injustice and connect access prevention. The HIS Learning Center, Khon Kaen University, stands ready to collaborate with you and to scale up this approach. Thank you.
So thank you so much. Especially thank you so much for stressing the importance of SDG 3 and 6 again, because these are the crucial points about today. Thanks a lot. Dear Miss Angli Nelson, hello, welcome again. Executive Secretary Manager, Bangkok Capital Group Holdings. What holidays? I'm thinking about the holiday. No, I'm not. So we look forward to hearing your insights, please.
Hello, good morning. Thank you, Melissa. My name is Angeline Nelson, Excellencies and distinguished delegates. It is a pleasure to be here today on behalf of BitCup. We are Thailand's leading digital asset and blockchain technology company. For us, innovation is not only about finance, it's about people. We believe progress should empower communities, improve well-being, and create opportunity for all. In Thailand, BitCup is advancing financial literacy, blockchain education, and digital skills development to ensure individuals, especially youth and underserved communities, are ready for the future economy ahead. Financial resilience and digital inclusion are the foundations of healthier, more equitable societies. But well-being requires more knowledge and technology for all. It requires dignity and access to basic human needs. That is why BitCup also supports clean water initiatives, helping fund water filtration and access programs in underserved Thai communities. Clean water means health, education, and opportunity. And we are committed to doing our part to help ensure no community is left behind. Internally, we promote mental well-being, balance, and personal development because strong societies start within the organizations themselves and with strong people. Our mission is simple. We use technology responsibly and compassionately so that digital progress becomes social progress, and every person has the chance to thrive. Thank you.
So much. Thanks a lot. Dear distinguished guests, our dear audiences, so we're going to go to the Q&A session as fast as possible. Have you got any questions to our panelists, to our speakers today? Because if you do not, I will have. Yes, please. Yes, but I...
Thank you.
Yeah, so ladies first, let's say. Is that fine for you? Yeah, thank you so much.
It's a welcoming factor. Go ahead with process. No
Okay,
issue
all right, thank you.
No worries. Let her.
What a gentleman.
Thank you so much, Melina. My question to the panel is, before that, I just wanted to say I have been a part of the Women's Major Group since Rio Plus 20 conference and are in constant dialogues on SDGs, particularly on gender equality and health issues of low-income slum dweller migrant women who, due to financial crunch, are compelled to go to inexperienced doctors and worsen their health, often leading to pandemic of the disease they are bearing, thereby losing lives. What steps, according to you, do we need to take to combat such situations besides water and sanitation, and where digital health concept hasn't entered?
Your question is for?
To the panel.
To the panel. Would you like to give an answer, dear speakers? Yes, please. Miss Angley.
Hello, hi, it's Angeli, sorry.
Angel, yeah, actually I have asked it, but I couldn't find you here.
If I may help answer your question as part of the panel here, I had the experience of working with Operation Smile Charity, which is a global organization that helps provide healthcare, and not just healthcare, but free healthcare and free surgeries for children born in the outskirts of Thailand, born with conditions such as cleft lip and cleft palate. While we were treating these patients, we often came across women who were in dire need of health care. We worked with local NGOs such as Matao Clinic in Masot province. And for me, I think it's very important for us to help fund and support local NGOs, especially in underprivileged areas such as where the borders meet, such as Mae Hong Son, Masot, and places as such. Yes, that would be my answer.
Thank you so much. Thanks a lot. Can we have the second question, please? Yes.
Yeah. The SDG 6 normally contains 8 targets and 11 indicators. The resilience is nothing but turning setbacks into comebacks. So that is the biggest challenge. How come the Nordic countries are faring well as far as SDG 6 is concerned, particularly the clean water, the sanitation, water quality, water efficiency management systems, waste management systems, and community-based risk management system? How are you going to improve the SDG 6 even though we have done fair progress from 68% to 74% on SDG 6 from 2015 to 2024? So how come the other least developed countries and island nations have to fare better on this SDG 6. B, big or small, human rights for all.
In fact, it's an amazing question and great remarks. Thank you so much. But I think 2 minutes for answering this and discuss about this will be not enough. We will have another session for this, right? This is a very important matter for equity, especially because our biggest problem in our world today, there is no equity. I'm also from the Middle East, and as far as I know, for Middle East, equity comes really many years later. So this is the rule of the world, they say, but we are here to break the rules, that's for sure. So have you got any questions to our speakers? Yes, please.
So my question is, when we talk about clean sanitation projects, I barely feel that when we talk about them, it's desirable but not feasible because there is a very big financial crunch. So what does the United Nations or any other financial body looks for solving these financial crunches? Thank you.
Thank you so much. I think this is similar to my question. Dr. Nisha Karanakran, I would like to ask this question, Dr. Nisha, and can we please answer this question with integrated my question at the same time? What lessons have we learned from raising global health crisis and building preparedness and health security, right? Yeah, our question is very similar. Yes, please.
Thank you so much for that important question. During the global health crisis during COVID-19, these have taught us about preparedness must be proactive, inclusive, and system-wide. First, we have learned for early detection and rapid response saves lives. Delay in surveillance, data sharing, and diagnostic can turn the local outbreak into global emergencies. Second, the community trust is non-negotiable. Misinformation, fear, and stigma undermine even the best technical responses. Resilient system must be people-centered, culturally sensitive, and transparent. Third, the health equity is preparedness. How prepared the nation are to face the global pandemic. And fourth, WASH, infrastructure is foundation. As the WHO Global Health Security Framework highlights, outbreak and antimicrobial resistance often emerge where water and sanitation access is lacking. Clean water enables safe childbirth, infection control, and also disease prevention. Fifth, we have seen values of regional and global collaboration. No country can stand alone. Malaysia's experience in ASEAN coordination and universal health coverage shows that how shared strategies strengthen collective resilience. And finally, we have learned that resilience must be programmed, not improvised. It requires investment in health force, digital system, supply chain, and also mental health services. Preparedness is not just about the emergency response, it is about building systems that can anticipate, absorb, and adapt. This is the future of the health security. Did I? Okay.
Thank you so much.
Okay, can I talk? Yeah. Thank you so much. I think we will have more time to talk about in the break session, right? Yeah, in the break time, that will be actually much better. I'm going to have the last question. Yes, please. I'm going to have the last question, and then I'm going to go through the closing remarks.
Yeah, thank you so much. This is Dr. Chino Kawatra from India. I've been leading 1 million plus volunteers in health and education sector. My question is especially for the collaboration part. How can youth be a part in the play a bigger role in this strengthening the health system? Because in India, what we are doing is right now, we are collaborating with youth and the healthcare workers, bringing, upgrading the government public health centers as well as the schools. So my question is especially to all the panels, especially because it is we are from the different country like Malaysia, then we have WHO, then we have universities. So how can a person like me sitting from India have a collaboration with you all to bring in a common healthcare system for everyone, not only for one particular country, but for all the, especially all the Asian countries, because we are facing the similar problems in all the countries. So how can we extend our hands with the universities, with the Malaysian government, with the WHO sitting there? How can we make a bigger impact because the youth are the real change maker. And when I go back to India, I need to answer my youth there.
Okay. All right. Thank you so much. Thanks a lot. Miss Angela Nelson, could you please answer this question, giving some maybe examples of how technology can empower communities to do healthier and more sustainable lives and beyond traditional healthcare access? I think we can answer these questions through your perspective, right? Yes, please.
Certainly, if I may. At Big Cup, like I explained earlier, we believe that healthcare and sustainable lives, it goes beyond just traditional healthcare. We believe that health and well-being begins within the organizations, and we foster this by providing wellness initiatives and supportive work culture. So within Big Cup, we have various health clubs. We have, for example, we've introduced run clubs, dance clubs, music clubs. We provide free counseling for our staff. We have nap rooms. We have snack bars, a snack station, which is refilled 3 times per day. So we have flexible work hours, and a lot of our staff can work from home 1 day per week. Now, by promoting this within the workplace, we are trying to set an example that a work-life balance can be achieved, and it has to start within each organization. You cannot say that you promote well-being at your company or organization and not show for it. We show for it. We have 1,000 employees under Big Cup, and we make sure that that our employees are, like I said, have a work-life balance. I think it's good that you discuss this within your organization and you find ways to introduce different well-being initiatives within your organization. Now, apart from this, what we provide for our employees, we offer free courses, which is accessible by anyone, and we teach them financial literacy, digital skills, training, and a lot about cryptocurrency. It's in Thai, and some of it is also in English. So I can provide you with more information after this session if you're interested. It can be accessible online, not all of it, and some of it is accessible through our application also.
Thank you so much. Thanks a lot. I think we will have more time to discuss and to share all about your perspectives, your opinion in the break time. So, dear ladies and gentlemen, our distinguished guests, and everyone being here today, the conversations we've had today are a reminder that progress happens when sectors work together, when governments listen to communities, when academia partners with policymakers, and when the innovation serves the public good, of course. So, as we leave this room, let's carry this shared vision forward that strengthening health systems begins with equity, prevention, and of course, collaboration. I would like to thank you to all our amazing speakers. Thank you so much for their insights. To each of you, thank you for your commitment, your attention, your continued work toward a healthier and more resilient world. Thank you. Now, let's eat something and let's have some coffee. Thanks a lot.
Gentlemen, it is now my honor to invite to the rostrum Giovanni Jing, Dr. Dakshinamurthy Ramu, Gokul Nath Mathia Sagan, and Dr. Tommaso Maggio. Significant milestone in today's program, the signing of a memorandum of understanding between the Sustainable Development Council and the UNESCO Youth Education Research Center, CREGU. This partnership marks a meaningful step forward in strengthening global youth education, research cooperation, and evidence-based actions for sustainable development. Through this collaboration, we aim to equip young leaders with the knowledge, tools, and international experience required to advance peace, a more equitable and sustainable world. Ladies and gentlemen, please join me to congratulating both organizations as we witness this important milestone. Lunch is now served. Kindly reconvene at 1:30 for the afternoon sessions. Thank you. Welcome back. We begin high-level panel 2, Mental Health Matters, Prioritizing Well-Being in Global Policy. This session highlights the critical role of mental health in national and global development agendas. Panelists will discuss policy frameworks, public health strategies, and innovative approaches to ensure mental well-being is prioritized alongside physical health. The conversation will explore how governments, institutions, and communities can work together to create supportive environments, reduce stigma, expand access to care, and embed mental health and universal health coverage and sustainable development efforts. Moderated by Dr. Venkestes Rao, President Doctors Wing, SDC, Director Dr. Rao, Dental Surgery Malaysia. Please welcome the distinguished moderator of panel, Dr. Venkestes Rao, to take the stage and introduce the panelists.
Thank you very much, Master of Ceremony. A very, very good afternoon to all of your ladies and gentlemen. A very, very good afternoon. A very, very good afternoon. Is everyone awake after a very good lunch? Yes. Can I hear a little cheers for the room, please? Everyone say cheers. Yes, thank you very much. All right. I just had a doubt if in case you all are okay or not after lunch, but seems to be okay, I suppose. Am I right? Thank you very much, ladies and gentlemen. I would like to invite our very, very distinguished speakers for today's wonderful session. Our first speaker will be YB Yuniswaran Ramaraj, who's the Member of Parliament for Segamat in Malaysia. Sir, you're most invited. I would like to invite Dr. Prawit Akarasare Nont from Thailand. Next, I would like to call upon Dr. Kawale from Thailand. And next, I would like to call upon Shri B. Lakshmikandan, IAS from India. Thank you. Are you all ready? Thank you very much. Thank you. Thank you very much. Ladies, gentlemen, and my dear friends, a very good afternoon to all of y'all. On behalf of the organizers, let me once again welcome each and every one of y'all towards this wonderful session today. And we bring a special forum to each and every one of y'all today with the topic of mental health matters, prioritizing well-being in global policy. Now y'all know the reason why I wanted y'all to cheer up just now. Because it's going to be a very, very important topic, not only for me, it's for me, for y'all, for your family, and for each and every one of us, ladies and gentlemen. Ladies, gentlemen, and my dear friends, according to the statistics of WHO, each and every 8 people, 1 in 8 people lives with global health issues. Yet more than 70% are actually not to be treated. particularly in the lower income and middle income countries. In Asia, with the pace of urbanization, digital overload, academic pressure, and workplace stress, which all have contributed to a growing wave of emotional stress. Among the working adults, more than 1/3 suffers from mental health issues. Whereas among the students, cases of depression and self-harm have doubled in the last decade. These figures reminds all of us that mental health is not a weakness, it is the foundation of human sustainability. Ladies, gentlemen, and my dear friends, we are not here to discuss statistics today. That too, on an afternoon session. Okay? It's about you, me, all of us, our children, and importantly, the shared community. As we gather here today at the United Nations Convention Center, let us remember that mental well-being is just not about medical issue. It is a policy issue. It is an education issue. It is a workplace issue, as well as, above all, it is a human issue, ladies and gentlemen. Let today's discussion move all of us to the awareness to action, from commitment to implementation, and towards a future of where health is truly means well-being. Today, we are truly privileged to be joined by exceptional speakers from various experts and various sectors, be it from the modern medicine, traditional medicine, academic, lawmakers, and various other sectors as well. Ladies, gentlemen, and my dear friends, let me introduce our wonderful speakers for today. Let me start with the speaker number one on my right, which is His Excellency YB Yang Berhormat Yuniswaran Ramaraj, who is a member of parliament for the constituency of Segamat in the state of Johor, Malaysia. As you look at him, he's a very young and dynamic parliamentarian who focuses strongly on youth empowerment, healthcare access, and social justice. Known for his grassroots connection and inclusive governance style, actively contributes towards the national policies on debates on education, health, and community development. Please give him a big hand, ladies and gentlemen, so that all of us stay awake. Next to him, we have Dr. Kawale, who is a Deputy Director of the Division of Occupational and Environmental Diseases, Department of Disease Control, Ministry of Public Health, Thailand. She's a very senior within the Thailand's Ministry of Public Health, expert in occupational and environmental medicine, leads the initiative on workplace mental health, stress, and burnout prevention. Looks very interesting, right? Advocates for mental wellness as a critical element of occupational health policy, brings actionable insight on workforce resilience and employee well-being. Please give a big hand, ladies and gentlemen. Thank you very much. On my left, we have a very senior person called Dr. Pravit, who is the head of WHO Collaborating Center for Traditional Medicine, Faculty of Medicine, Siriraj Hospital, Mahidol University, Thailand. He heads the WHO Collaborating Center for Traditional Medicine, Associate Professor at the Mahidol University Siriraj Hospital, internationally recognized expert in integrative and mind-body medicine, research focused on holistic healing, traditional wisdom, and modern psychiatry. He also brings WHO's perspective on blending traditional and scientific approaches for global mental health. A big hand, ladies and gentlemen. Next to him, we have another very senior person, His Excellency Sri B. Lakshmikandan, IAS. He's a former district collector of the government of Andhra Pradesh in the country of India. He's a distinguished Indian Administrative Service Officer, served the district collector and magistrate court of a district called Krishna district in the state of Andhra Pradesh, India. He's also a recipient of the University of Oxford Lifetime Achievement Award for contribution in education and governance, champion of youth-oriented governance and human-centered administration. He offers deep insight on integrating mental health into the governance and implementation of frameworks. Ladies and gentlemen, a very, very big hand, please. Guys and girls, I've introduced our wonderful speakers for today. Are you all ready to hear all their insights? Yes or no? Can I have a big yes, please? Thank you. Thank you very much, because this will be helpful not only for you, but for you to carry out the message and make sure that you educate your surrounding people out there. Thank you very much for your cooperation. My wonderful speakers, we will go ahead with 5 minutes for each and every session for you all to present yourself. All right? And then we have a group discussion.
for probably about 2 minutes for each question, and then we'll open up the floor for the Q&A. Are we okay? His Excellency, YB Yuniswaran, to open up the forum, I would like to hand over to you, sir, please.
Thank you, Dr. Rao, as a host, and also for inviting me, actually, for give a great opportunity to meet all of you. And we are talking about health, so I hope all of you are very healthy here in the room. First of all, I think I was told by Dr. Rao that after this, we have 5-kilometer walks. So I think you all must be ready to walk with us. Well, thank you very much, Your Excellencies and fellow panelists and esteemed delegates and guests. It is a great opportunity to be here to talk about health. Yeah, I think as a policymakers, I've been constantly fighting in my country for banning vape. It is one of the bigger crises, and also is actually the bigger burden that our country is facing right now. Is more harmful and dangerous than the tobacco. And Singapore has banned, and we are constantly being affected. As a lawmakers, we definitely will focus on budgeting allocations. We give more budget on managing the crisis, but we forget that we should be investing and managing more on to preventive care. You know, bring more awareness on health, especially the NCD. According to the United Nations report, almost 73% of NCD, I mean the total death of is caused by NCD, is a non-communicable disease, which is heart, related to lungs, and so on. Also, the mental health sectors. So, as we know that we can see the world children, and we must measure that for terms of well-being, the World Health Organization report was by 25% surge anxiety and depressions globally after the pandemic, COVID pandemic. So I think our healthcare system was challenged, was literally faced a very tough time after the COVID pandemic. So I think it is a time that we need to constantly advocate on mental health and also general health and well-being of our country. And Malaysia is heading to aging nations in the next 25 years. And same almost the ASEAN countries. Many of us are heading to an aging nation. So the preparation on investing into health, I mean public health and general health in every part of a sector, I think it is very important as a policymaker. We have a bigger role. And of course, we also engaging with the United Nations in Malaysia, especially on the health sectors, constantly putting pressure. You know, I'm a government backbencher, and I have a lot of different opinion when it comes to health. Sometimes I critique my own government, you know, and we have introduced an end game section in policy, which is like we are barring those children who were born in 2007 are not eligible, or you are not allowed to buy cigarettes. And unfortunately, the law was amended, not passed. I was very disappointed about it, because we are actually able to bring a big generational gap to save this generation, and we're still working on it. So, and I think I'm end here for now. Thank you.
Thank you, YB. Thank you very much for the very aspiring start. And next, can we move to Dr. Kawale?
Yes, of course. Good afternoon, Excellency, esteemed college, and our member. It's such an honor for me to be here today. And for me, I will talk about the policy. Policy only works when implementation is shared. In Thailand, we have Healthy, Safe, and Happy Workplace program illustrate this approach, co-led by Department of Disease Control, Department of Mental Health, and Department of Health. We continuous improving to all this for over 10 years. Internationally, as a WHO Collaborating Center for Occupational Health, our roles include capacity building, research, and surveillance on stress and psychosocial risk. In addition, we closely collaborate with the ILO and the ASEAN Health Cluster on workplace mental health issue. For more than a decade, our program Healthy, Safe, and Happy Workplace has followed a total worker health approach. The program includes mental health screening, observational checklists for emotion and behavior, workplace relaxation activities, esteem buildings for employee, and clear referral pathway when needed. The takeaway for this program is simple. A healthy enterprise is not defined only by a zero accident, but by safety, dignity, and happiness. We have seen improved satisfaction and harmony, 5% reduction in smoking and drinking, and underserving through fewer accidents and injuries. They are small, but concrete signals say that prevention is pay. Thank you. This is my point.
Thank you, Dr. Kawale. Sounds very short and simple, but you need a lot of effort to do that, ladies and gentlemen. Right? Can we move to the next speaker on my left, Dr. Pravid?
Okay, thank you very much. I'm honored again to visit in this consortium. First of all, I would like to say that actually the mental health and well-being is one of the parts that WHO in the teaching medicine section will implement this. You may aware that on the 26th of the May, they launched the WHO strategy in medicine for 10 years, 2025 to 2034. They have 4 objectives: evidence, policy, integration, and collaboration. And one of that is the mental health and well-being and sustainable. So I think telemedicine and modern system should be complementary, not competitive. Modern medicine provide diagnosis, medication, and emergency intervention. But about the telemedicine, we offer the holistic care, cultural sensitivity, and long-term balance. The goal is the patient-centered integration under shared standard of safety and ethics. So in the part of the traditional medicine, especially in here in Thai, we use the Thai traditional medicine called TTM. We integrated, actually we have a practice called the Thammanamai, body, mind, and behavior. Actually in the part that TTM integrated mind-body therapy, herbal medicine, and spiritual care alongside modern psychiatry, joy training, shared referral system, and implementation research ensure safety and evidence-based practice, making integration both scientific and human-centered. So, the take-home message is that what I to say, mental health must be woven into every system and culture. The Thai experience show that blending traditional wisdom with modern policy, advanced UHC, and sustainable well-being for all. Thank you.
Thank you very much, Dr. Pravid. That's a very insightful combination of the modern medicine with the traditional wisdom, I would say. Thank you very much, sir. Now I would like to call upon Mr. Lakshmikandan, sir.
Thank you very much, the moderator and the panel members and my dear audience. Good afternoon to all. So mental health is not a privilege, it's a right. Fight for right in the daylight and might, which is the greatest light and bright to the system. Mindful today, soundful tomorrow. Speak to the mind and find the kind. So this seems to be the most important phenomenal exercise in the mental health. Nearly 1 billion people are suffering in the world from these mental health disorders. The highest prevalence has been noticed in Lebanon, countries like Lebanon and Iran, and the lowest prevalence has been noticed in the countries like Taiwan, Vietnam, and other Southeast Asian countries. This is the most important thing for the overall human development. The very first exercise what we have to do on this mental health is integrations. Integration, coordination, and sharing of experiences, what we have to focus. That means expand the access to the care, ensure the affordable, available, accessible mental health care in all the community levels, in all the low income and middle income countries. And then we had to make a shift policy from the treatment approach to the promotion of prevention approach. The Mental Health Action Plan 2013 to 2030 includes comprehensive and integrated responsive services system. We need to have the cross-sectoral collaborations where the mental health is integrated and collaborated with the primary care, physical care, personal care, and public care. And we need to develop some sort of interdepartmental coordination among the various departments like education, labor, housing, social welfare, and social justice. We have to develop some sort of life skills like communication skills, stress management skills, accept the weakness and convert into strength. We have to focus on SWOT analysis to SOAR analysis. Strength, weakness, opportunity, threats have to be converted into strength, opportunity, aspiration, and results. That means in the education curriculum, we need to incorporate all the life skills and stress management. We have to focus on digital health mechanisms, focusing much and much on this tele-mental health initiatives, and then focusing on trainings, capacity building measures. Because on the whole, the globe is losing nearly $1 trillion every year because of this anxiety and depression levels. And then the mental health has become a global burden, and it has reduced the lifespan nearly 20 years from the normal person. So apart from the sectoral collaborations and departmental integrations, we need to focus on the community-based disaster risk management, where the Sendai framework from 2015 to 13, they are focusing much and much on the understanding, strengthening, investing, and finally the enhancing the disaster risk reductions. So likewise, we had to focus on these parameters. And then finally, we had to, the 5 C's of the mental health. What are the 5 C's of the mental health? The very first one is the competence. The second one is the confidence. The third one is the communication. And the fourth one is caring, and the fifth one is character. And then as a parent, everybody should be committed to follow the 777 rule. What is the 777 rule? Spend with the child 7 minutes in the morning, and 7 minutes after coming back from the school, and 7 minutes before going to the bed. And we need to focus on this work-life balance. This is the most important phenomenon where we can reduce the stress. 8 hours for the work, 8 hours for the sleep, and 8 hours for 3F, 3H, and 3S. What are these F, S, and H? Family, friends, and faith are the 3 F's. Soul, smile, service are the 3 S. Health, hygiene, hobbies are the 3 H. Then only we can see the most important, a 5-letter, scintillating, unbeatable, inimitable, impeccable word in English dictionary. That is known as smiles. S-M-I-L-E. This is the thing. Most of the people say that which is the biggest word in English dictionary? Pneumono ultramicroscopic silicovolcanoconiasis seems to be the biggest word in English dictionary, which contains 45 letters. But the wise people are saying that it is not the lengthiest and biggest word in English dictionary. Smiles is the lengthiest word in English dictionary. How can we say that 6-letter word smiles?
Very sorry to
This is known as in between 2 S, mile is there. So with these words, I am expressing my gracious, grazy, salamat, obrigado, arigato, merci bien, and merci big up. Simply as 8-letter English word with a small space, it is thank you.
Thank you very much. I will respond to that as thank you very much once again. That was very, very insightful. And there you go. Can you see how insightful were all our speakers giving on the individual perspective from different sectors of expert. Ladies and gentlemen, now it's going to be a flow of discussion with individual question. I would like to start with our policymaker from the country of Malaysia. Sir, you have mentioned very well just now. I mean, I was really attracted to the, what you call the proposed amendment of policy in the country to ban the purchase of cigarettes, which I feel it's a very good idea so that we set an age limit in each and every country on the purchase of cigarettes can be done. But unfortunately, probably it was not passed in the parliament. That's okay, but as an individual, individually looking at the school, how do you think the teachers, the parents, and everyone, the councillors can play a role, even though the law is not being passed, as an integrated system, how each and everyone can play a role so that this approach can be succeeded, sir?
Thank you. This is actually regarding generational end game policy, which is like provisions control of tobacco products and smoking bill 2022. That would actually ban tobacco and vape product sales to anyone born after January 1st, 2007. And the reason, okay, the key aspect of this, how this idea came was actually, and also the proposal is actually to prohibit, ban the use of and purchase, possessions of tobacco and vaping products, individuals who were born in 2007. The ultimate goal of this GEG is to eliminate tobacco use in the future generation by making illegal for a specific birth cohort to exposed to these products. And the benefit is expected to significantly reduce of healthcare costs by preventing smoke related. The reason is because we are collecting tobacco tax, almost 2.3 to 2.5 billion. But we are spending almost 8 billion for health sectors who are related to tobacco and cigarettes, lung disease and anything that related to smoking. So I think actually this is already beyond and burdening the government and the healthcare. As I mentioned earlier, after this COVID pandemic, our healthcare system was tested. I think many countries are not well prepared, and many systems are collapsed. Many countries have faced a very hard time. I think, and adding with this, that man-made crisis, and I also would like to highlight, one of our panelists says that about the Sendai framework. If you notice that in the Sendai framework, almost 90% disasters are man-made because we have failed to make plans, failed to make correct decisions, which are man-made disasters basically. That's where the Sendai framework came. So if we look into it, and this must be integrated with many other sectors like education, schools and teachers, and it also related to mental health. I would like to share very sad things to be in this room because there are many students here. There's one incident happens 2 weeks, 3 weeks ago in Malaysia. There's one boy, he's 14 years old, and he stabbed a girl who is 16 years old in the same school. When she was in the washroom, the guy rushed to it, and he stabbed her for 200 times. It has happened just 3 weeks ago in Malaysia. And this is a very, very saddening and a very, it has shaken the whole education system, where the boy and why he become in such situations. What's happening at home? Is his mental health is taken care? Is the environment is good? Now a lot of young people have been exposed to a lot of video games, and these are the big challenges. So I think the education system has an important role in providing an awareness of a good health. I think the school should, start on. I think every schools have these sports lessons. I guess we only have half an hour. I think we only focus on a physical health instead of doctrinate these policy things should start from schools. We can take in Singapore. Many rules and law has been taught in the primary schools. It is basic things. So I think when come to health, and we have to wait, things happens, somebody died, then we have to act. I think this is something that we really need to look into it. As I say that we have actually overwhelmed with so much of the entire, I'm saying about my country, how the healthcare system is exhausted, how it has been put so much of pressure. Then we still not reach the minimum budget. We had I think healthcare system was the third largest budget in Malaysia. So these are the challenges we have. Number one is actually, as you asked, doctor, I think number one is the healthcare. The education plays an important role. How the schools, bring a lot of awareness. The school must have a lot of tours to visit the hospitals, see the patients. These are the practical things that I think the students must have the exposure at a young age. Number two, I think the parents are also playing a very important role, and the community. Is it now? And I think as the parents are busy with work, we are into so many daily routines. We actually overlook what's happening at home sometimes, what our kids are doing at home. So I think thirdly is about the parental guidance and support to help them. And when you say no, so there's where people are interested to know what's happening. The interest to know whether to explore to the bad and so on. So I think the fourth one is actually the community as well. The community also playing a very important role to help each other. So, we know that children are smoking in front of us. And in Malaysia, I would like to say that you are not publicly can smoke in any eateries. You will be fined. You cannot smoke in the restaurants. It is very strict, and we have imposed a very high amount of fine on these matters. So we are actually moving towards it. Yeah, we are really looking into it and working on the collaboration with many other stakeholders and with the parents. And we are continually having a lot of dialogue session. And Malaysian Parliament has initiated every session. We almost invite 50 schools, head of the schools or head of the class, to visit parliaments. We have a dialogue section with the students. So we are telling them how the policies are made, what are the policymakers' job, and how these public health educations are playing an important role, and leadership. So this is initiated by the Speaker of the House, Tan Sri Johari, and it's very good. So far we have reached more than 100 over schools. So these are some initiatives that we can invite schools in our districts to visit the state assembly or national assembly and have more inclusive dialogues with the policymakers. I think this really helps to bring a lot of closure to the school level students. We can start this from the secondary schools, colleges, and universities. I think that these are the things. And also, the most important is we need to have additional budgets on our parliament for all the countries who are here present. As if you are related or working in the parliament, we should look into it. How much we are spending for mental health awareness? How much are we really putting effort? Have a psychologist in the school. The children are going through hard time. So I think schools are playing important. There are some schools we have counselors, and there is a counselors are limited. When you have more than 500 students, you are eligible to have a counselors. So I think these are some of the that things that we need to bring changes. So as I mentioned, the four things: the schools, the community, family, as well as the government. Everyone is a play important role on health matters, and also regarding mental health. I leave it here. We'll continue some of the points later. Thank you.
Thank you very much, sir. That was a very, very deep answer that you see. The whole responsibility, end of the day, is just not only on the policymakers, but as I mentioned earlier, why I wanted all the attention, because the whole implementation of action actually is all depends in your own hands as well. Be it as a community, be it as an individual, or be it as a parent, friend, or towards all your surrounding people. Ladies and gentlemen, I would like to move to Dr. Kawale. Doctor, how can public sector and the private sector work together to make mental health part of the occupational safety standards?
Yes, for the private sector, we hope. I think it's not only private sector, but it should be like the whole community. Based on this situation that from Malaysia, everyone will feel like very sad, right? And I feel like the foundation here is the mental health literacy. That is not just public, private, or something, but whole society have to be the part of that. If you give the mental health literacy to community, it can reduce stigma. Yeah, I think stigma is the single biggest barrier to early help seeking for that boy, right? If they early help seeking, it may prevent this tragedy. And also mental health literacy also can empower people with the 4A competency. Yeah, the first A is about the access, reliable service and information. and acquire a deeper understanding of determinants of stress or something or for that disease. And the third A is place content critically in the era of the infodomics like this. Place, yes. And the fourth A is about apply the knowledge to self-management and to supporting others. So I feel like if 4A present and it's come together, it can move communities from awareness to action. So for me, it's not just public-private section. Thank you.
Thank you very much, Dr. Kavale. Once again, the answer is community-centric, right? And I would like to move to Dr. Praveet. Doctor, that was a very wonderful and very wonderful presentation on how you combine the modern medicine into the traditional as well. You see, we are gone from the days where modern medicine is just modern medicine, traditional medicine is just traditional medicine. Nowadays, we're trying to go more holistic approach so that both can work together, integrated together for a better well-being. That was a very nice presentation, a very nice approach, Dr. Praveet. I would just like to know what, in terms of key policy, what is your recommendation would you like to suggest to WHO or national government for integrating holistic well-being approaches?
Okay, thank you. Actually, this one I have been asked for a long time when the visitor visit our center. And last year, WHO meeting in the global meeting in the Beijing talk about how we integrated modern and Western medicine. This is the one that I have talked on that meeting. I think it's the key to pathway, this one. But the one word, the first, you need the trust from the Western doctor. But how you can get the trust?
Okay.
How can you get the trust? You starting with the how is the importance of integration. Don't overclaim. Just say, oh, this one I can use, this one I can use. No. Just say that telemedicine almost is the prevention, promotion, rehabilitation for the actually treatment in the acute. Quite less. We have to show that we can do that and complement or integrate that. And then that means precise time and integration. You can put it. And then when you do it, you know how to manage that. That means critical pathway to success. And when you succeed already, try to overcoming, like the word to translate. Because sometimes the term in the telemedicine and in the Western quite different. When you know, in telemedicine, almost the key is body element, earth, water, wind, fire. Western, you don't know. You have the term that's similar. I use every time. Think about the blood vessel. You know, internal blood vessel is the anatomy. It means the earth, it's structure. But the blood cell need the water or blood inside. It means the water. They move. It means the wind. But the energy occur. It means the fire. That's it. Understand. And then you can go on. Okay. And then if you succeed in some practice, that means your success story. And then you go more on that one. And then if there are another that can practice, you can challenge it. At the moment, I think I work on the 20 years ago. I'm the medical doctor too. Actually, I'm based on the pharmacologist. The first time I come to help the Center of Applied Traditional Medicine, I to say that my friend is the clinician in the Sierra Hospital. Help me to integrate it. He say, what can traditional medicine can do it? I just say this one is evident and then go. About I think it's about 20% of the staff at the Sierra accept that. Now I think more than 70, and some ask me how can we use traditional medicine. Recently about the trauma, like the wound, like the afterburn, step. How can we early movement, something like that. So this is the key. Okay, that is my point. Trust first, and then you can go more. Okay.
Thank you very much, sir. Next, Dr. Lakshmi Kandan. How can the best practice enhance coordination between youth education and health departments as well?
So the best is not a just experience, it is a first experience. Normally, we have to follow some best practices, discussing with the international level and the intersectoral approaches, interdepartmental coordinations, and finally, within the organization, the uplifting of the youth perspectives and promoting the best practices at the organizational and cultural level, where we have to set up a supportive culture in the schools, in the educational institutions, and in the workplace, where we can talk freely about the mental health without any fear, psychosis, and stigma. And then we have to be the leader, to lead by example. There are different types of leaders working in the society. A good leader creates followers, a great leader creates leaders. Then lead by example. There are different types of leaders. The today's leader is tomorrow's leader. We have to work in that angle, promoting the leadership methodologies and promoting the global coordinations. And the second type is the resource and program best practices, particularly EAP program, Employee Assistance Program, where it shall be conducted in a confidential way to promote the counselings. And the same thing has to be replicated in the schools and educational institutions, where a free atmosphere has to be created by promoting this assistance program. And then we need to develop certain capacity building and training exposures, where they have to focus on socio-economic determinants like poverty, and then discrimination, inequality, unemployment, abuse. These are the things where we have to focus and select the mental health supervisors to create a lot of counseling things. And then we have to promote the universal, virtual, accessible services and tele-mental health initiatives to touch the hard-to-reach population. That means it has to be work in a 5-pillar model: availability, accessibility, affordability, equity, and quality. And then the policy, best practices. Renew the policy, update the policy to match with the individual needs of the mental health person, and create some safety guidelines, and then consider the accommodations like free and then free working hours, and then promoting some sort of remote stipends also, and encourage the unplugging mechanisms.
Thank you very much, sir. Ladies and gentlemen, without wasting time, I would like to further open the floor for Q&A. Guys and girls, please keep your question very straightforward so that it's much more easier for the panels to answer you. Thank you very much, and it's open to the floor. Yes, the little young girl over there. Yes, showing the love sign. Come.
Hello.
Hello.
Hello, I'm Arirat or Ariana. I'm from Richmond Life School, and based on what you guys have said earlier, I have one question that it may be basic, but I want to know, as an adult who's like fully work in the big organization and big works, you work with a lot of people, so how, and you also work with the mental health that you mentioned earlier. So I want to know, if you can rule the world one day, what rule are you going to change? Because even though that there's a lot of call out about mental health in adult, but do you know that aside from teenager that have like suicide rate that is so high, another group of people that suicide rate also high is the adult. So I want to know, how can you manage your feelings, or how can you like, how do you want to change? Because I'm pretty sure that, no, and I am sure that if the government or people, they really, really pay attention to this point, many things about mental health in every group of people will change in a better way.
Thank you very
Thank
much.
you.
May I have your name again, please? Ariana.
Ariana,
Such
yes.
a wonderful question, and what I was very impressed is how you want to change the world with the one rule question. And since it's related to policy making, I think I would like to direct the question to the policy maker over here. Great, sir.
Thank you, Ariana. Thank you, Dr. Rao. I think it's a big challenge now. No one can escape from this challenge, you know. Even I think I am still a worker. I'm a member of parliament. I'm still working. I'm taking care of 100,000 voters. Maybe not many like other countries here. You know, I think first of all, my mental health must be very stable. Yes, very true. I can see is now a lot of young people going through depressions. No, this is the challenge we have. In our days, like 20 years back, 30 years back, the way we are trained, the way we are molded at home is different. We are actually trained like we have been pushed into the lion's cage. You know, we are being set out to face the challenges while we are very young. You know, the reason is like, you know, the environment is different now. And I believe now the environment is totally different. The work environment, the sexual harassments happening in the workplace, you know, women are being intimidated, you know, instead of seeing what is their capabilities and abilities. So these are the things that I think make someone who feel they have been not valued, feel that they are not given a space. So I think it is, number one is actually government to government, and I will explain to you, government to private sector. I think they must have integrations and collaborations. And it must be the first thing, you know. So when we go and apply a job, you know what they ask the first thing? Problem solving. Do you know how to solve the problem? That means they already tell you there's a problem in your place. You know, we are hired in a company to solve their problems, which means we must be resilient. We must be enough equipped with the knowledge and ability to handle crisis. So I think they must have approach in the sense like, you know, provide a safe and healthy work environment. And it's very important. So I have worked, before I became an MP, I worked in many sectors, in F&B, in retails, you know. I worked in many spaces. So what we actually practice is like, we give them assurance on a healthy and safety environment. It's very important. I think that's why I say is a government and private sectors has to work together with the NGOs, with the stakeholders, constant have forums to bring this as a national policy issues. As a mental health or work environment is actually a very big issue. It affects the company's productivities. It affects our health as well. As I mentioned earlier, you know, there's a 12, 14 years old boy, you know, just imagine 14 years old. How can he exposed in such ways? And of course, he's faced a big stigma, you know. So I think as a policymakers, I think we are actually also managing such crises. And we have a lot of NGOs submitted memorandums. We have in Parliament, we have Parliament Select Committees on Health and Women. And I'm actually the member for International Relations and International Trade, where we call the minister in the respective departments to come to Parliament and answer if there is any allegations, anything that we are working on. In Parliament level, we have Parliament Select Committees, and we also have APPGM, which this committee consists of government, oppositions, and other stakeholders who are expertise, who in this committee, who are really study and work on these projects. So, and we also have others. And I believe that, okay, many of you don't know, our doctor here, I would like to tell also, he actually a special officer for former Deputy Education Minister in my country. And, you know, we are close in discussion on health, education as well. So to answer Ariana, actually as a policymakers in Malaysia, what we are doing is actually we are working hand in hand with many stakeholders, NGOs, government, non-governmental, international organizations, because the issues may look the same, but the challenges are different every day. So I think to assure, especially women, we taking more advancing, more precautious on policy and strategy. And we also have a Ministry of Women in our country, definitely I think most of you have. So we also constantly have a discussions to look into on these matters. So in my opinion, we must also be prepared You know, when we are going into the working world, is totally different than what in education, in the study times. It's two different world. What we are studying and what we are in the field are two different things. So we must be prepared. As a young generation, we must be prepared. I believe that these questions is very important questions, and you guys are uprising now. I can see Gen Z is everywhere. You know, they have been doing a lot of things outside, but don't follow them. Do the good things. Thank you.
Thank you so much for your answer. Thank you so much.
Thank you very much. Sir Ariana, are you clear? Thank you very much. And one more last question, please. I can see a very young man over there. And young man, can you introduce your name? And importantly, I want to know your age. And you can go ahead with your questions, sir.
Hello. Yes, I am Divyam Shah. My age is 10 years.
Please give me a big hand, please, ladies and gentlemen. Very, very big hand. Come on. Very, very, very big hand. You know why? Look at an 8-year-old boy, right?
10 years.
10-year-old boy is over here today taking a responsibility to change the world, man. So if we don't do our role, I feel we got to learn from him. Please give him another big hand, please. Thank you. Young man, please go ahead.
I have a question for Dr. Pravit.
Dr. Pravit, sir.
You talked about living in harmony with nature, like water, fire, earth, etc. Then, what about other living beings like animals and birds? What about them? Wouldn't life be better if we even lived in harmony with other living beings like animals and birds?
So do you mean how can we use this concept in the term of the Western? That's right. I try to understand what your question.
I'm saying that you talked about living in harmony with nature, like earth, fire, soil,
Oh
etc.
yes, okay.
So
Actually, the nature is the balance. You know, I'm actually is the concept of the Western is the balance already. But maybe you know, actually in the ancient, if we will got the healthy, we should live in the balance already. But the balance in the ancient, because the ancient they didn't know the technology, they have the environment. So they try to observe the environment compared to their body. They try to classify, okay, in Thai cuisine we have 4 body, in Ayurveda have 4, China have 5, but all that same thing, related to the natural. Earth, wood, fire, wind is the same, but all of it should be balanced. And the concept, the core, but the core is still moving in the research. Because if you try to understand, okay, the major is the Ayurveda and the Chinese. The Thai is mean mixed between Ayurveda and Chinese. So we have collaborating center. Actually, we have collaborate around the world already. Actually, I just organized the meeting on the last 3 months. So we try to understand what your theory in terms of this body element, and try to get the core, the same thing that we understand. That means the core that we understand, we should understand in terms of the science. Because you learn, I'm sure you learn with the science and modern. If we expand in the science, we can say in the same thing, the same understand. You can see that's one, the same thing. But sometimes it's not enough, because the new generation, you use the IT technology. If we develop the AI technology, okay, think about the power dancing. Okay, in Chinese, Chun Guan Sư, in the Chinese, maybe I'm wrong, sorry that. In Thai, Vata Pitta Semha. Ayurveda, Vata Pitta Kapha. Same thing. We use the when our center develop the AI technology, we can map this, change into the like the digital side, and then you can say the same thing. If you're interested, you can actually I published already in this one in the frontier. You can go to read from this one. But how can we lie? Just the balance. The balance. You can see on the slide. Yep.
okay, thank you.
Yep. Ladies and gentlemen, very, very big hand for him, please. You know, the last question. Divya, you know, the last question, I actually wanted to announce that I want a question for traditional medicine and with the modern medicine. because it's something very unique which we need to give a lot of emphasization in this world. But at one glance, I saw a very young man over there. I thought I'll give you an opportunity, but you actually asked the question which I wanted to. Thank you very much, sir. All right, very good job to you. Your question is definitely very, very unique, beyond that what even sometimes adults can think. Do you all agree with me? Please give him a very big hand, please. Thank you. Ladies, gentlemen, once again, a very, very big hand to all our distinguished speakers. Please, very, very big hand, ladies and gentlemen. As I've mentioned earlier, the whole approach of mental health, it's just not on individual, but it is a more centric of a community towards your whole surrounding. Just on a very quick sum up of the whole discussion today, our beloved member of parliament in Malaysia have shared how they are pushing policies to even ban the purchase of cigarettes in the school level, which I truly very strongly agree on that, and how the schools, the parents and the counselors must play a role on educating kids on not to purchase cigarettes, be it from vaping, or also the conventional cigarettes. Wonderful. And then moving on to Dr. Kawale, she have explained the approaches which must be community-centric to focus on. And then moving to Dr. Pravid, he have explained the methodology of modern medicine, combining with the traditional medicine with all the methods on how you should be looking into. And moving to Dr. Lakshmikandan, he have shared a few concepts, especially on the 5 C's, 7-minute rules. And what really attracted me is the power of smile, ladies and gentlemen. Each and every person, when you look at them, and if you just smile, do you think they can suffer of mental issues? That's the most powerful tool, I suppose. So this wonderful session have summed up into all this. Please try to take it very personally, to bring into your practice on a day-to-day basis, so that each and every one of us can play a role towards eradicating mental health. Ladies, gentlemen, and my dear friends, today's discussion has reaffirmed that mental well-being is not an optional, but yet it is a fundamental to sustainable development, be it from policy to practice, from schools to workplace, modern healthcare systems to traditional wisdoms. Mental wellness must be treated in all connects of aspects. The journey towards universal healthcare coverage begins with compassion, guys and girls, understanding and collective responsibility. Together, let's make mental health a shared global priority, ensuring no one is left behind, be it in this pursuit of happiness, productivity, peace of mind. Ladies, gentlemen, and my dear friends, before we end this session, I would just like to share a quote from my very beloved teacher that we learned from and we practice on a daily aspect, that never ever try to compare yourself with anyone. Instead, just try to be better than what you are currently are. And one more quote that is very personal to my heart. Again, always be a reason for others to smile and have a better life. Ladies and gentlemen, thank you very much.
Distinguished guests, ladies and gentlemen, it is my privilege to invite Dr. Shilpa Naigar, Chief Dental Surgeon at Apollo Dental, India, to stage to deliver the keynote address. Please give a warm round of applause for Dr. Shilpa Naigar.
Hi, good afternoon, everyone. Excellencies, distinguished delegates, esteemed colleagues, and friends. It is an honor to address this gathering of global leaders, visionaries, and change makers, and to speak about a force that is quietly transforming our world: the power of self made women. Across every nation, every culture, and every sector, self made women are redefining what leadership, resilience, and success. They're entrepreneurs, innovators, dentists, scientists, doctors, artists, health workers, so more, who have carved their own paths, often without privilege, often against the odds, driven by courage, conviction, and purpose. These women are not just building their own futures, they're building future for others, creating jobs, mentoring young girls, driving social innovation, and contributing to economies and communities in ways that lift everyone around them. Yet their journeys are rarely easy. Many have faced barriers that are invisible to others: limited access to education, financial resources, our network of influence. Many have had balanced professional ambition with family responsibilities, navigate cultural norms, and confront systemic gender bias, and still they rise. They rise with determination, transforming challenges into opportunities. They rise with creativity, bringing solutions to the world's most pressing problems. And they rise with compassion, ensuring that their success paves the way for others. But empowerment cannot rest on individual strength alone. It must be supported by systems that recognize and nurture women's potential. Ensure that leadership spaces, from boardrooms to parliaments, reflect the diversity of women's voices and experiences. When we invest in a self-made women, we are not only empowering individuals, we are strengthening the foundation of herself, but how she multiple impacts for others. She is a teacher who inspires girls to dream. She stands at the world's new vision, empathy, and resilience that women's leaders bring. Let us commit to breaking the structural barriers that limit women progress. Let us celebrate women not only when they succeed, but also when they struggle, persist, and try again and again. Let us make space for every woman from every background to dream, to lead, and to thrive. Because when a woman rises, her community rises. When community rises, nations prosper. And when women everywhere have the freedom and opportunity to fulfill their potential, the world becomes more peaceful, equitable, and sustainable. To every self-made woman and to every woman still on her journey, your courage lights the way. You're not just changing your own story, you're changing ours. So one such self-made woman is standing here and giving a speech in United Nations Conference in front of you all on integrating women's health in everyday life. It's an honor to stand before you today to speak on an issue that remains silent in global health discussions: oral health, and more specifically, the empowerment of women through oral health. Around the world, oral diseases affect nearly half of the global population, yet oral health is rarely included in universal health coverage or national health agendas. This neglect is not just a gap in dental services, it is a gap in equity, dignity, and opportunity, especially for women. Women's oral health is uniquely influenced by their biology and by the roles they play in families and societies. Hormonal changes during puberty, pregnancy, and menopause increase the risk of gum disease and tooth loss. Pregnant women with untreated oral infections face higher risk of preterm births and other complications. And yet, across many countries, oral health is not part of routine maternity or primary health care. At the same time, the social realities make things worse. Many women, particularly in rural or low income, cannot afford or access dental care. They often prioritize their family's health over their own. The result is pain, lost productivity, and diminished well being, issues that ripples across generations. But, Excellencies, we have the power to change this story. Empowering women in oral health begins with integration. Integrating oral health into universal health coverage program, primary health care, and reproductive health care services. When oral health is part of your routine checkups and school programs, we protect not just teeth, but futures. Empowering women, it continues with education, ensuring that girls and women have access to accurate information about oral hygiene and nutrition. A mother empowered with oral health knowledge becomes an agent of change for her family and her community. And it requires investment in work-based training, data, systems, and communities-based programs that reach women where they are. Oral health promotion can be woven into existing public health structures, from midwives and ashas in India to community nurses in Africa to primary care team across the world. Colleagues, this is not only a matter of health, it is a matter of rights and sustainable development. Prioritizing women's oral health supports multiple sustainable developmental goals. When women are healthy, families are stronger. When women have access to care, communities thrive. And when we recognize oral health as essential to women's empowerment, we take a step closer to truly universal health coverage. So today, I call upon all of us, policymakers, ministers, and community leaders, to make oral health a core part of our national health agendas. Let us ensure that no woman suffers silently from preventable oral disease. Let us empower women not just to receive care, but to lead as dentists, educators, policymakers, and advocates. Because a healthy smile is more than a sign of good health, it is a symbol of equality, confidence, and human dignity. Finally, to conclude with, the most successful ones are not the most powerful ones, but the most kindful ones. So be kind to the near and dear and to all the living organisms in the world. The kindness will bring success inevitably. Thank you. Thanks for the opportunity.
Ladies and gentlemen, it's now time to honor an inspiring individual whose remarkable work is making a real difference in advancing the United Nations Sustainable Development Goals. May I kindly invite Honorable Mr. Yuneswaran Ramaraj, Member of the Parliament Government of Malaysia, to come forward and present the prestigious recognition, the SDG Impact Award. May we all warmly welcome Dr. Shilfer Niger, Chief Dental Surgeon at Apollo Dental, India. Oral health, and her dedication to community outreach and health education exemplify the values of the United Nations Sustainable Development Goals, particularly SDG 3, good health and well-being. Her tireless efforts continue to inspire healthcare professionals around the global south and beyond, fostering a future that is healthier, more inclusive, and truly sustainable. Ladies and gentlemen, please join us in congratulating Dr. Shilfer Niger, recipient of the Leadership in Preventative Dentistry and Sustainable Health Award. may I kindly ask. Next, we'll call Mrs. Ananya Dasgupta, member, Women's Major Group, Global SDG Advocate. Please warmly welcome her. Mrs. Ananya Dasgupta is being recognized for her extraordinary contributions to education, gender equality, renewable energy, and sustainable community development, and for her tireless efforts in empowering women, youth, and underprivileged communities through meaningful action and awareness. Her leadership, spanning classrooms to global platforms such as CSW UN Women in New York, Rio Plus 20 in Brazil, and World Renewable Energy Congress in Denver, reflects a lifelong dedication to the United Nations Sustainable Development Goals, SDGs. A multi-award winning educator and changemaker, Mrs. Dasgupta's work radiates compassion, innovation, and purpose, inspiring a generation towards inclusive growth and sustainable transformation. Please join us in congratulating Mrs. Ananya Dasgupta, recipient of the Women's Empowerment and Sustainable Education Award. UNP. Next, high-level panel 3, AI for Health, Building Safe, Inclusive, and Sustainable Solutions Together. This session explores how artificial intelligence can transform healthcare systems while ensuring safety, ethics, equity, and sustainability remain at the core. Experts will discuss responsible AI innovation, regulatory frameworks, and practical applications that enhance medical services, data systems, and patient care. The panel will highlight opportunities for collaboration across technology, health institutions, and policymakers to ensure AI advances health outcomes for all, leaving no one behind. Please welcome the distinguished moderator of the panel, Mr. Tommaso Maggio, education consultant, to take the stage and introduce the panelists. Please warmly welcome him.
All right. Thank you, everyone. Thank you for stay somehow alive until this time. So it's been a long day, very intense, with a lot of interesting insight from well-being and all related topics. Thank you again for being here. So let me be short in the introduction, so we have more time for our speaker today, our panelist. So today the topic is AI and health, building safe, inclusive, and sustainable solutions together. I'm Dr. Tommaso Maggio. I work on education as education specialist and cultural wellness advisor. So before we begin, I felt to Dr. Ramo for organizing such great event with so much effort. And today we play basically intersection between innovation, design, and of course, mental well-being. So we will discuss basically how AI can age health outcome and stay human-centered. So we must keep up with our being human with a profundity what does it mean. So our conversation play with two main SDG. The number 3, as you all know, is good health and well-being. And number 9, that's triangulation between industry, innovation, and infrastructure. So helping me to welcome today, so all the panelists. Let's start with Dr. Donna Robinson, founder of Medicals Asia, was Bangkok-based practice champion inclusive accessible care. And then we have Rupali Babu, CEO BSX Design. She worked between deep insight and fairness on gender, technology, and design. Move on with Jean Giovanni, Vice President of CREGU, Research Center for Youth Education for UNESCO. Philip Joshua, CEO of PRVNT, advancing AI-powered preventive health solution that enable early detection and personalized care. Not last, Taref Jeffrey is founder of Apply.ai, where basically explore through this platform mental well-being and organization culture through intelligent system. So welcome you all. Thank you for being here. Let's start. Good. So again, thank you all for being here. Such a pleasure to have this panel in front of you. So I can say that in this panel are all people that I truly admire. So it's an honor to have all of you at once. So pretty amazing. So let's start with a serious question that I prepare just one question each of you, and then we move on with something more spicy. All right, so let's start with Donna. Donna is a doctor that does this long-term practice, right, based in Bangkok. So from your experience, what is one of key safeguards that make AI safe and trusted by patients on one hand and doctors alike?
That's a great question. Can you hear me? Yeah?
You need to touch.
Oh, okay. Hi there. That's a great question. What makes AI safe? How can we protect patients and doctors and nurses? You know, at the end of the day, we're probably all using AI. Aren't we all using ChatGPT in this room? Yeah? Everybody. But yes, I think you are. But at the end of the day, you can use it to look at patient care, you know, even check on the diagnosis, check on the lab reports. But the doctor has to check everything and has to sign off everything. So it's a great help, but we've still got, it's almost like a little helper, but then we've got to use it to sign off. Because sometimes it's been inaccurate, I found once or twice. Have you found it inaccurate once or twice? Yeah, you did. Yeah, just once or twice. So that's what I would start off with. The you know, and the human touch has to be there.
So thank you for the insight. Thank you for the insight. So basically what you say, yes, good to use, even in your practice, very specific, but of course, as an extension, not a replacement.
No.
Not, right? All right, thank you. Let's, because we want to be fast with this panel, all people that are different way. Now we have Rupali. Thank you for being with us today. So since you are an expert and bridging between design and behavior science, let's say in this way. So one question that I know you are a bit aficionado of this, how we can ensure that AI in health doesn't deepen gender and socioeconomic gaps? What design or policy tools can help on your perspective, of course?
Thanks, Tommaso, and thank you for your word of confidence in calling me an expert. I don't know, but I'll try to answer the question. how can AI in health ensure that it doesn't deepen gender or socioeconomic gaps? And I think the most important point that we need to make sure is that it's inclusive. It's not the prerogative of Bay Area VCs or coming out of China. You're seeing lots of interesting AI solutions coming out of countries like Guatemala, Kenya, Ghana, etc. It's more important to determine what problem it's going to solve for, who is going to be using it, and who's going to be building it. These are the key questions that need to be answered in order to make it inclusive. The other point is, of course, make equity measurable. And in simple terms, it means that can the algorithms work for most? I'm not saying all, but most. And as we know currently in AI health systems as of today, they're still being trained on data sets that are skewed more towards male data or male-oriented data. And we need to have data sets that look at women, marginalized communities, and people who are binary as well. And then, of course, the last one is access. It's not just for the privileged. It needs to be made accessible to many. And while we have access, it also needs to be made easy to use. We do know with AI solutions, they tend to get abandoned quite quickly if people think it's too difficult to use or they don't understand it well. So that's what it is in a nutshell. I know in the interest of time, I won't tell you my favorite story about Jacaranda Health, but I'm happy to discuss that later.
All right, thank you. Thank you for raising the point. So yes, a lot of bias anyway with those AI, whatever platform you use, most of the time is male-centric. You notice even when we play most people on visual, you see, try to type beauty or women and see what is the product. It's always the same stereotype, just to simplify elements. Okay, thank you again. Let's move on the next one. So with Mr. Jin from UNESCO and Craigu Youth Center. So as you work a lot, but I mean a lot with youth, how do you see AI influencing daily well-being, and what school should or community should do now to prepare, to be better prepared?
Yes. Okay, thank you. And before I'm trying to answer your question, I want to say that did you ever try to ask this question in an AI software or somewhere you can get some answers from the internet or something? But I would like to say is, if I want to answer this question in the way that I already experienced it, so AI cannot respond something like that because it's my own experiences.
Exactly.
And so I want to say that also the students and even in high school, in university, they need to get prepared to use this AI technology. And this is the only things they need to do. And that's the first thing. Why they need to get prepared? Because now a part of my job is doing sustainable development research project in the University of Florence. I'm now a researcher in this university as a part of the research laboratory in this research system. And I sometimes feel like the students are now learning in an environment that is sometimes lack of the real autonomy, because we give them a lot of work to do, and we give them a lot of tasks to complete. And also sometimes we give them a lot of facts to memorizing. But we didn't give them enough time to use their brain to improve their ability of thinking and something like that. I think for the students who have already get used to use their brain to think, the AI is actually a really good thing. They can use this as a very efficiency tools to help the study, to help the research, because they can easily find a lot of information, something like that. But for those who are not get used to. They didn't have a real goals in their study, and a lot of students now has this problem because they have no real goals, and they didn't find out what they want in their future to improve their what kind of ability to make them to get into the professional world in the future. For those kinds of students, they used AI technology, and they just want to complete the short-term goals like the examination, graduation, and maybe some license they want to get. But actually, it's not helpful for them. It's really not helpful. So I think we can change our way to teach. That's the first thing. That's the first thing I want to say. Second, there's no such a lesson called "learn how to learn" in school. Also in high school, middle school, maybe also in university. We don't teach students how to learn, and we just start to teaching all the knowledge and all the things they need to learn, they need to complete. And a lot of students actually don't know how to start to learn. They're using the very easiest method to learn, like memorizing repetition and try to remember the vocabulary or something. But I think for those kinds of students, they need more time to think about what they want in the future, to have their own ideas about how to achieve a future that is appropriate for their goals in the future. So I just want to say, in short, the students need just to have a good environment to learn. And if we put a lot of pressure, especially in the Asian schools, I get around in Asia, and I went to Hong Kong, I went to Japan, also in China, it's obviously it's a very huge problems, and the students has no interaction, and also has no room for passion.
I see.
Sometimes they put a lot of values of the industrial ages, something like that. I think this is all the problems we need to solve for the young people, and to give them more opportunity and more chances to going through all of these things, and to let them have more opportunity to think about what they want in the future. That's the real thing.
So if I can summarize in a couple of lines, so we need emphasize on critical thinking for students, because that's what is needed, and then show and teach how to learn. So be sure the student want to learn for the sake of learning. So do we really still need grades in 2025? Why we need grades? It's easy, of course, for educators sometimes, but probably the way has been done in the past doesn't work anymore. So we need to evaluate those elements, and maybe through this, they can see a different value.
That's true.
So we can go on with this conversation, but we can even move to the next one. Thank you for your point. Very important. Philip is here, flying from Dubai, where basically he's developing this platform where work between well-being, and AI driving. So the question is how AI-driven innovation redefine well-being and healthcare. Accessibility, particularly in what is your focus, preventive health. Can you give you a glimpse?
Okay. AI and healthcare, possibly the biggest buzzword today, where you see millions and millions of dollars investment pouring in as we speak. So how AI is changing healthcare as we speak today, it's immense. AI is making not just healthcare, but preventive healthcare more accessible for people from the lower income segment and people from the countries which are up and coming, which doesn't have access to good healthcare systems. For example, before there was this case where shortage of radiologists. You need good radiologists to understand or examine a CT scan or any scan for that matter. Today, AI in general has solved that as a problem, where eventually it could even replace radiologists, has someone or something that can do that job for doctors to understand a scan better. Not just in diagnostics, right? In terms of understanding patterns, how well this person is sleeping day in and day out, how much are they moving, what are they eating, and AI can give a better insight that a doctor can utilize to probably consult or give a better treatment plan. I wouldn't suggest AI to give the treatment plan, at least not yet, but an AI can definitely help a doctor understand a patient better than anyone, because typically a doctor spends, 10 minutes understanding a patient? 15 minutes? How much can someone understand about them with that 10, 15 minutes time? But AI, in 2 minutes, can go through an array of data from their past history, blood work, family history, and can give a better insight about that particular person to the attending doctor, much better than anyone else can. AI is changing things like this, from diagnostics to pattern recognition to understanding a patient. Then there is this whole ambient listening where AI constantly listens the conversation between the patient and a doctor, gives a better insight than a doctor himself could. There's so many different things that AI is changing in healthcare today. But that being said, though there are so many different advantages, there is equal disadvantages, I would say, at least for now. There is a huge privacy concern going on. HIPAA still don't have a clear clarity on guardrails for AI. How do you protect sensitive data? Yes, like Rupali was talking about inclusivity. IBM is working on something called AI 360 degree, which kind of eliminates the whole bias in terms of treating, for example, differentiating between two different racial groups, between, let's say, the whites, the blacks. Progress is happening, but is AI ready for the mass market today? I would say no, though I am building one today.
Thank you. Fantastic explanation. So I'm sure that basically what you explain, you will have a deeper conversation with Dr. Donna, for sure. So basically that can be your briefing assistant, his platform, and then you have in your screen before you met the next client, the next patient, somehow, if I understand what you're doing. Okay, so let's move into, thank you again. That's fantastic and good to know that somebody's finally, I would say, doing something tangible, because a lot of talking about those topics, but we see practical things in this. And Mr. Reef, thank you for being with us again. And you are an expert in building a fantastic platform that many working places are using nowadays. So my question for you is, how can tech and AI meaningfully support mental well-being, not just measure it?
Thank you for the question. I think that we got a lot of fundamental assumptions wrong from the start. And so we really need to use, and we're able to today, use data to help us better understand the problem, right? So this is something that we are measuring for the past 8 years. We're measuring how happy people are at work. We're also measuring 300 other factors. And we found that during COVID, people got happier at work because I guess they got to work in their pajamas, but their well-being plummeted. And it didn't just go down 10, 20%, it went down more than that. And what it allowed us to see was that the real problem was that when people left in-person work, they left their connections behind. Their relationships became fractured. And we saw that after they returned back to work post-COVID, their relationships did not come back with them because our bad habits of using digital tools for asynchronous communication stayed with us. So ultimately, if the assumption is not that well-being is caused by work-life balance issues, etc., but by fractured relationships, then we could solve the problem in the right area. And I think that's when we can apply AI correctly. For example, using AI to help enhance organizational empathy, where we can allow AI to help us, nudge us in the right direction to create the right relationships and help people at the right time.
Yeah, basically you can collect the right amount of data, and AI help you to analyze and put in a canvas, but easier to understand, let's say, so to the owner or the CEO, so they have a better charts, let's say, because usually just number. Sometimes people, when you give all those number, will be surprised, but even unable to do what is the next action, what I need to do with all this data. Same in this case. But what you are building, both of you, you're building something that are are already tools, basically ready. Basically, you give the key. They are just to turn at this point. So
Yes.
thank you.
Thank you.
Thank you very much. So thank you all. It's not finished yet. So if you want, we could, but we move to the floor. So where do you see the biggest opportunity for collaboration between health professional, technologist, and educator? So any of you feel to start? So Dr. Donna already.
Yeah. Hi. How do we see the biggest collaboration? Well, I don't think as medical people, I'm a doctor, that we're pretty weak, a lot of us, with AI. Even my telephone has been set up by my IT person at work, really. And I mean, they've set up all these apps for answering patients, like Respondio. So I can't work alone. There's Respondio, there's using questions, ChatGPT. But again, I still think the human-centered approach, is something that I agree with you all, that it's still missing in AI, that you can't take my job away. And I'd still like to explore more about where educators fit in. So maybe you could answer that question with the other team.
Thank you. From education point of view?
There's a lot of, biohackers showing up on Instagram and all the other platforms recently, giving information on how do you reduce your cholesterol, how do you reverse diabetes. Yes. Instagram is filled with doctors, or wannabe doctors, I would say, or influencers today. It actually is a double-edged sword, I would say, right? People don't know the reality. One thing would have worked for X person, the same would not work for the Y. Right. But then they go out on the Instagram, talk about, okay, how this has changed their life, right? Education, I think, in healthcare should be a bit controlled. China recently came up with this whole law where you need to have a degree to be an influencer in a particular category or a field, right? I think that I welcome that a lot, because today this whole biohackers are kind of ruining, though I'm not a medical professional, I do understand what value a doctor brings onto the table. No one can replace their insight at this point. Not a biohacker, not a longevity expert. But today, healthcare, education in healthcare is kind of ruined, and I feel like there needs to be a guardrail or a policy in place where it restricts people with no background in healthcare talking about healthcare.
Wonderful point. I think that is very relevant. Anybody else want to raise?
Yeah.
Please.
I think that's a great question. Oh, it's not working. I think it's a great question.
It's still not working.
Oh, it's still not working. Maybe I could yell. Oh, there it's working.
I
think it's like the trifecta. You have health professionals, you have technologists, and you have educators. And it's co-creation. That's the greatest opportunity. We like to advise our clients in the for-profit sector that an AI solution or tool cannot be the domain of the IT team. And the same principle holds here. The health professionals are the ones who are going to define the needs, and they bring that expertise that no one else can bring. And I don't just mean doctors, I mean nurses, I mean frontline workers. When you look at the healthcare system on a macro level, we're just not talking about hospitals, we're talking about how delivery mechanisms happen, both in a city and in rural areas. The technologists, of course, are the ones that know to do the coding, they know to build the tools, they know what kind of solutions need to be done in-house, security, cloud storage, etc. I won't go into it. And the last bit are your educators. At the end of the day, many of these tools are going to be used by people who are quite removed from the places where medical expertise is delivered. So many of the solutions, especially given what I like to focus on, like in remote Guatemala, for example, are done by frontline workers, social workers, and they need to know how to use it safely and also be able to convince pregnant women about the use of these equipment, or the AI solution, for example, or women out of Africa, or Kenya, who need to access telehealth services through the means of Jacaranda Health platform to get timely, real-time, personalized help as pregnant women and then for postnatal care. So this is where that kind of education needs to come in to the community, so nonprofit sectors, the community workers, etc. So rightly, as Philip said, like it needs to be really looked at who's controlling that and with what kind of responsibility as well.
I cannot add anything else. So, I don't know if Giovanni or Riff want to add anything, or you can answer the last question eventually. How do we make sure that AI stay human-centered and has become more advanced in health and well-being? Something that touch you somehow?
Sure. I think in the workplace, I guess with any use of technology, if it makes it easier to do something, we end up using it, even if it's not a good thing to do. So I think it's one of those things where ultimately good judgment needs to play out. And how do we then scale good judgment within our organizations and in communities? I think that has to go back to education. And I think a big part of what leadership is today and tomorrow is about that. I think we've seen this a lot with AI use, and post-AI use is without strong leadership, the use of AI has become very sloppy. There's a lot of things being done, but very directionless and not very clear. So I think that it allows us to see what's really important and what's not. Right? The idea that we can write emails 5 times faster, yet our productivity hasn't really improved by any means, is probably telling us that we're applying AI in the wrong areas to begin with. But ultimately, we're applying AI in areas that are curing or treating inconveniences rather than really curing bottlenecks. So I think those are the things that we need to do to redesign incentives within our organizations. Right? One of the biggest requests that we have as an AI company working with workplaces is, can you just create an AI manager? Right? I don't like my manager, can you just create an AI version so that they will do all my performance reviews, etc. And the data is too clear that we shouldn't do that. That the manager-employee relationship is actually a really important part of growth, development, and even happiness and well-being. And just because you have a bad experience doesn't mean that you can then just use AI to replace it. So I think that we have to be very conscientious about where we use these tools. And so, I think there's a lot of work still to be done there.
Thank you. Very important point. So that's pop up. I think Giovanni wants to say something because he says Pong to education. You want to add one last word? Or is enough?
Actually not. I think he's enough for the...
Good enough then. All right, so let's open the floor. Open the floor. If anyone has a question, yes, 1 and 2. Okay, go ahead.
So greetings to all. My question is, as artificial intelligence rapidly transforms global health systems, there is both an immense promise and a profound ethical responsibility in ensuring that AI is driven innovation and help us rather to save, not kill. Inclusive and healthy outcomes, how could UN strategies like through UN or WHO or any other affiliated bodies to ensure that AI remains human-centered, transparent, and follows the principle of equality, safety, sustainability? Thank you.
Yes, of course.
Okay, so to keep it human-centered, so I run a preventive care company. We rely on artificial intelligence for a lot of things. So we call this as augmentative intelligence, or however you want to pronounce it, where it's a collaboration between artificial intelligence and a human being, right? But to achieve this, we need to have certain guardrails in place. When I say guardrail, there should be clear rules and regulations set where, okay, insights is taken from the AI, but the final call should be taken by a human. Such policies, if clearly established, could make sure that human is always part of any AI-related activity where AI does not directly diagnose or consult a patient and give him a treatment plan. That should not happen at any point in time. Even if AI is able to easily pass USMLE or any given education, that doesn't give it any authority to treat a particular patient, like how Tarif was talking about. Building a personal connection, having that understanding is essential in creating a treatment plan. To answer your question, having a clear guardrail defined by bodies like UN, WHO would help or would make sure that AI is always human-centered.
Thank you so much.
Thank you for answering. I think the lady, yes, please.
Hi, good afternoon. My name is Natalie and I'm from the Philippines. My question is, in the Philippines, access to technology is still unequal, not just for hospitals, but for students and ordinary citizens. As we build AI for health, how can we make sure these innovators truly include and educate everyone, not just privileged ones? Thank you.
Hi, Natalie. But usually the AI, and I think we're all talking about ChatGPT, isn't everybody in the Philippines using it on their telephones? That doesn't really answer your question, does it?
It does not. I'm actually looking for a different type of answer.
What sort of-
Something that is more deeper than that. Because everyone in the Philippines, they uses phones, but mostly none of them really know more about technology. They just, maybe they hear something about ChatGPT, but they really don't know what more ChatGPT is all about. Maybe some of them, they know that they can get answers from ChatGPT, but if you dive more deep into it, they don't know what really ChatGPT is.
So then we deep into what Giovanni was mentioned before, is about education, educating basically the new and old generation. So 90% of people talking about ChatGPT, they never use, right? So there's just a certain percentage of people, at least they use in a professional way. Probably that's what is needed. And for instance, but ChatGPT and actually the company of ChatGPT, they make free ChatGPT for the entire nation of India starting in October 2025 for 1 year. That's something that only the company can do. But again, once you are for free, what you can do if there is no education about this, if people are not thinking in a critical way. So it's not just copy and paste. So you need something before. So you need to reinforce education before moving to any technology. Please.
Hello, I have a very small question to ask. Referring to AI and robotics, which is a better mode of alternative treatment to human treatment? Will AI replace robotics completely?
Please.
Okay. So it kind of complements each other. It will not replace one another. Robotics is more like a medium that delivers. Artificial intelligence is more a set of codes and algorithms that understands everything. Robotics is just a medium to deliver things. Robotics does not have a mind of its own, if that makes sense.
Yeah, so I think it's like a body and a brain, right?
Yeah, exactly.
The robot is the body without a very smart, intelligent brain. We just have to tell it very clear instructions, how to move from point A to point B. But now with AI, it has a smarter brain, so it's able to make decisions and judgments by itself, which makes the robot arguably more dangerous if not, controlled well, but also more powerful and useful if done well.
Hi, just to say, I think in hospitals where a patient could be so sick, they really don't have a choice because you're following a robotic or an algorithm, then I think AI is probably going to help you a lot. But in the community, when people are asking all different questions for all different reasons, I see that AI is helping us for routine, repetitive tasks like what is your cholesterol, but not really what the patient's biggest concern is, why they had a cough today or something like that.
Thank you so much.
Thanks to you. Yes, yes.
Okay, so good afternoon to all distinguished guests and panelists. My name is San. I am a high school student from Thailand. And these questions may be like relate to our earlier discussion about mental health. So I recently I heard a really sad news about a young person taking his life because of the AI chatbot. Like he have been influenced by it, and this is like become a huge controversy. Like some people say that AI is dangerous and we shouldn't use it in terms of mental health, but others also says that in the fact that young people use AI for their mental health problems also reflects many things in the society, like maybe their parents like haven't take care of him that much, or the culture itself like pressure him too much to like seek help from professionals. So now we have two problems. One is the safety of the AI, and the other is a kind of society that cause mental health issues. So my question is, if we really have to choose between focus on developing a perfect AI that can give mental health advice, or we can choose to focus on building a society that is more friendly and supportive to our mental health, even if it takes a longer time to achieve. Thank you.
Thank you for the question. Thank you for raising the point. And I think you already answered your own question because, again, how we can make a tech tool better if we are not better, right? So everything starts from ourselves. So if you don't understand yourself, then you can use any technology. Technology can be good or bad, but since any technology, even the printing, when they start, they say, most people say, was not good for do some tasks. Same with AI, seems a new task or new technology while it's 50 years old. And of course, that depends how you use, what is the context of it, right? So it's always back again to education. But education is not just school. Education is the place where you live, the context where you stay, what you say when you are with parents, with which friend you're working with. So that's make your persona, right? And then you need to develop your critical thinking. So education is never just copy and repeat. It's just be curious. And the key is keep the curiosity of keep learning. That's basically the goal of any education. And that's how basically we will keep AI human-based. So if AI help us to keep alive our curiosity, doesn't matter age, that's is our goal.
Tommaso, I'd like to actually take that question.
Yes.
Me. Your question was, it's basically a trade-off between either designing a perfect AI solution to help with mental health or societal reforms that create a supportive environment so you see reduction in mental health, right? Think of it this way. It's not a trade-off of one versus the other. It's going to take a much longer time socially to gain acceptance, to do more research on mental health, to build those infrastructures out there. Meanwhile, there are many people that currently will not be diagnosed, and so AI is that tool. So, for example, there is an AI tool that non-specialist doctors and nurses in Dhaka and Bangladesh are using when pregnant women come to visit them and maternity women, and they're able to, the AI tool helps them to diagnose if there are signs of depression, postpartum depression. Now, these women would not have been identified as suffering from postpartum depression. It doesn't mean that the AI tool is now going to be dispensing medical advice or counseling. They are then passed on to the professionals. But so think of it as a tool on that journey that will help social infrastructure to be put in place in the long run. So that's the way I see it. And also very quickly, Natalie, your question about making sure AI was not just the purview of those that have privilege, you're very right. But it's a question of not just access, it's a much bigger question because it's how we deliver education systems. Even in studies where they did give access to AI, your GPT type tools, women still didn't actually use it in comparison to their male peers, and it's because many of us are not used to working on technology or in the STEM areas as children and then going forward. So this needs to be more of a government focused initiative in putting that also in the AI policy in the Philippines. That's my response.
Wonderful. You want to say one last thing?
Just want to say, the sad news you gave us that, someone took their life. We've all filled out these online questionnaires, and many of them aren't very accurate. I mean, could there be more control over what's put online?
Yeah. Thank you for raising.
I'd like to add, I'll just finally finish this off. So your question was more towards ChatGPT pushing him towards the edge, correct? Yeah. So consider ChatGPT to be a general AI. It's not specific to cater to mental health needs. There are different AIs that is being built as we speak that caters to specifics like Google's Medgamma for AI diagnostics, and there are other ones that kinda is utilized only for mental health. Right? It is our duty to understand or to differentiate between two different AIs to know what is offering what. That's first. Second, but in case someone does not have access to any other AI and ChatGPT is all they have to offer, we still need policies to regulate these things is what I feel. There should be guardrails in place. Just because it's not a mental health based AI, it does not give it authority to answer whatever or push someone towards something, right? That is an existing problem which I recognize. But I think OpenAI is building tools to make sure that doesn't happen. If today you go ask these, if you have this conversation with ChatGPT 5, it will not give you any answers. It will ask you to go talk to a professional. Right? Slowly things are moving. Unfortunately, we might have to have such problems to highlight such issues. Without such issues, I don't think there would be regulations or policies in place. If that answers your question.
Sorry, time is up. Thank you, everyone. Let me conclude. So, 3 things. So, basically, we discussed 3 things. Trust comes from transparency. And when you talk about ethical design, listening closely to people with a real experience, not just experience from I read on ChatGPT, right? Inclusion means design for gender, socioeconomic diversity, youth, community, as assessed from the start. And when we talk about sustainability, we need to ensure that AI tools are not just innovative, because it doesn't mean anything, but usable, maintainable, and integrate into daily life. So our call, this panel call, and the entire summit call is simple. The call for action is to one tangible step. So whatever is fairness in design, engaging youth voice, or ensuring mental and physical health, all of these go hand to hand. So embed that in our work moving forward. So thank you again for all this work you say today, an important point you make. And once again, thank you all the panelists and the organizer for this fantastic opportunity to be here. And let's remember the message for today. Basically, innovation in health must be human-centered, ethical, and inclusive. Thank you.
Voices shaping tomorrow's health leadership. Mr. Parag Shah, Aram Yuva Seva Group. Please warmly welcome him.
Do I start? Good afternoon, everyone. Today, I'm going to tell you a story in just 3 minutes about two boys named Raghav and Ravi. In the world of global health, a different PPT, please. Thank you very much. So good afternoon. I'm going to tell you a story about two boys in just 3 minutes named Raghav and Ravi. In the world of global health, we experience two distinct realities, the reality of choice and reality of circumstance. So let us meet Ravi. He lives in the first reality, reality of choice. Ravi loves eating junk food and enjoys casual smoking. Like Ravi, for many, living healthy or living unhealthy is a result of their own eating habits, their addiction, and their own lifestyle choices. The power to change lies within their own hand. On the other hand, let us meet Raghav. He is living the second reality, reality of circumstance. Raghav is not unhealthy because he is not eating good enough food, but he doesn't have enough food. In this reality, a child's future is not stunned by his own choices, but by an empty stomach. In this reality, well-being, or rather I should say unwell-being, is a result of poverty, lack of knowledge, and crushing absence of resources. In this reality, a treatable disease like kidney failure becomes a life sentence, not because they do not value their health, but because they cannot afford the dialysis treatment. Raghav is battling a circumstance that he did not choose. He is battling, someone needs to step in. And this is not just a story about one Raghav. There are millions and millions of Raghavs around forgotten corners of the world who needs help. And that is where our group, Arham Yuva Seva Group, has been operational for last 20 years, identifying those who are trapped by circumstance and building bridges for them. Over 20 years, we have built several bridges, but today I am going to name a few. First, we built the nutrition bridge by providing hygienic and nutrition meals to thousands of people every day. Secondly, we bridge hygiene bridge by providing clean and hygienic toilets to the rural schools, especially for the girls, because dignity is the first step towards well-being. And we built medical access bridge by providing free dialysis and other medical treatments, because life should not have a price tag for rich and for poor. With over 1,000 active volunteers and 55 centers with ATG and FCRA compliance, we have a very scalable and proven operating model. We are here today to partner with you to seek your expertise and provide our on-ground support so that Raghavs from every corner of the world sees the light of good health. I would like to end my presentation with a quote from Rashtrasant Param Gurudev Shri Namramuni Maharaj Sahib, and that is also, he is also our inspirer, and this is our mission statement, that human is someone who has humanity. Thank you.
The Sustainable Development Council has always been dedicated to empowering the next generation, our young leaders who will shape a sustainable future. Now, it's time to hear our youngest speakers of the day. Please join me in welcoming Master Divyam Shah and Master Badra Atolia from India to deliver their presentation. Please warmly welcome him.
Presentation? That first presentation, yes.
Good afternoon and Jai Jinendra to all respected delegates and my dear friends. My name is Badra Tolia, and if I asked you what this is, you'd probably say a tummy. But what if it gets too big? We call it obesity. It's a burden on the body. But today, I want to speak about something even more concerning: mental obesity. What is that extra burden we carry in our minds? Let's begin with a few facts. As per WHO, 1 in 8 people are living with mental health condition, majorly anxiety and depression. Over 700,000 people die by suicide each year, which is 1 every 40 seconds. Even more concerning is the decline in mental well-being among young people, which often leads to multiple physical issues as well. Now, imagine your mind as a beautiful garden with a variety of colorful and fragrant flowers. But what if we let too many weeds to grow? Weeds like anger, stress, negativity, overthinking, that which makes our mind too cluttered and unhealthy. That, my friends, is the real crisis of our time.
Namaste. My name is Divyam Shah. We are not here today just to discuss the weeds. We are here to share the weed cutting tools found in the ancient wisdom of Jainism, as taught by the super scientist Bhagwan Mahavir centuries ago. Let me share 3 powerful and practical tools for overcoming mental obesity with you. Number 1, Kayut Sarg, the brain rest. As per Jain philosophy, it simply means to pause, cut off your mind and focus on your breath. Let's try it together right now. Please close your eyes for a moment. Inhale deeply and exhale slowly. Inhale, exhale. Inhale, exhale. You may now open your eyes. We can integrate this into our daily routine. Even a single minute can bring powerful results. Number 2, mantra, the sonic massage for the brain. The simple sound of mantra is like a gentle vibration that massages our nervous system. This practice has even been validated by modern neuroscience. Number 3, apology, the power of forgiveness. Anger is one of the heaviest burdens our mind carries. The antidote to anger is apology. This practice lightens our heart and purifies our mind. We are deeply honored to represent Lukanlan Jain Gyan Dham, an institution rooted in value-based education, inspired by the vision of Rashtra Sant Param Gurudev Shri Nambramuni Maharaj Sahib. Right from the age of 3 years, we have learned and implemented several such techniques integrating moral education with healthy habits. These practices have touched more than 1 lakh lives globally.
We welcome you to our spiritual center, a place where spirituality means practicality, to align the mind, body, and soul to create a true well being rich in health and harmony. With heartfelt gratitude to the UNSDC for giving us this opportunity, we strive not just to build a healthier body, but a peaceful mind and compassionate world. Thank you.
Master Divyam Shah and Master Badra Tolia. Now, for the closing remarks, please join me in welcoming Mr. Gokulnath Mathiazagan, Secretary General, Sustainable Development Council, to deliver his remarks. Please warmly welcome him.
Distinguished delegates, esteemed speaker and partners, as we come to the close of the enlightening and powerful day, let me begin with my expressing heartfelt gratitude to each one of you. From your presence, your ideas, and your unwarming commitment to building this healthier and more sustainable world. Today, we journeyed through the entire spectrum of global health and well-being. We begin by reaffirming our shared vision that health is a universal right and the foundation of peace, prosperity, and social justice. Our keynote leaders reminds us the public health challenges are not just medical issues, but moral and development responsibilities. From universal health coverage and digital health innovation to mental health, nutrition, and community-centered care, each session deepened our understanding and strengthened our river. Our dialogues on climate resilience, health system, water and sanitation, gender equality, and youth leadership highlighted the interconnections of health and sustainable development. We also witnessed inspiring partnership through provoking panels, discussions, and meaningful commitments of government institutions, youth leaders, and civil society. Throughout the day, one message remained clear: health security and human dignity, and shared goals that require shared actions. To all moderators, panelists, delegates, thank you. Thank you for your wisdom. Thank you for your presence. To volunteers and organizing team, thank you for your dedication and seamless effort. And our international partners, your collaboration continues to make this platform stronger after a year. As we leave today, let us carry forward the energy, the ideas and solidarity we have built there. Let us translate this conversion into the real world action in governments, in institutions, in communities, and within ourselves. Together, we are not just witnessing a change, we are shaping it. I wish you all safe journey back, and thank you. Thank you for everyone. Thank you.
Ladies and gentlemen, this concludes the formal program. Please join us for high tea and and networking. Before leaving, I'd like to kindly inform all delegates to collect the certificates distributed at the entrance. Thank you for being part of the World Summit on Sustainable Health and Well-Being 2025. We wish you continued success and collaboration for a healthier, more sustainable world. ขอบคุณค่ะ Another announcement, there's coffee sold outside for anyone who's interested. Have a great evening.